Hey, Alpha Nurses, I'm Licensure from alphanurseguide.com. This is 130 practice NCLEX questions. Without the way, let's get started.
Phenylephrine, an adrenergic agonist, has been prescribed as a topical application for a patient who had intraocular surgery. Although systemic toxicity is unlikely, which adverse physiologic response is the concern? 1. Cardiovascular response, such as hypertension or ventricular dysrhythmias. 2. Renal response, such as urinary retention or urinary incontinence. 3. Respiratory response, such as bronchospasm or mucus plugs. 4. Musculoskeletal response, such as bone pain or joint stiffness. The correct answer is 1. Cardiovascular response, such as hypertension or ventricular dysrhythmias. Topical phenylephrine usually does not cause systemic reactions because the amount of absorption is very small. Cardiac responses are the concern. Other possible reactions may include sweating, tremors, agitation, or confusion. The nurse is preparing to administer a beta-adrenergic blocking glaucoma agent. Which statement made by the patient warrants additional assessment and a notification to the healthcare provider? 1. My blood pressure runs a little high if I gain too much weight. 2. Occasionally, I have palpitations, but they pass very quickly. 3. My joints feel stiff today, but that's just my arthritis. 4. My pulse rate is a little low today because I take digoxin. The correct answer is 4. My pulse rate is a little low today because I take digoxin. All beta-adrenergic blockers are contraindicated in bradycardia. Alpha-adrenergic agents can cause tachycardia and hypertension. Carbonic anhydrase inhibitors should not be given to patients with rheumatoid arthritis who are taking high dosages of aspirin. In the care of a patient who recently sustained blindness, which tasks would be delegated to assistive personnel? Select all that apply. 1. Counseling the patient to express grief or loss. 2. Assisting the patient with ambulating in the hall. 3. Orienting the patient to the surroundings. 4. Encouraging independence. 5. Obtaining supplies for hygienic care. 6. Storing personal items to reduce clutter. The correct answers are 2. Assisting the patient with ambulating in the hall, and 5. Obtaining supplies for hygienic care. Assisting the patient with ambulating in the hall and obtaining supplies are within the scope of practice of the AP. Counseling for emotional problems, orienting the patient to the room, and encouraging independence require formative evaluation to gauge readiness, and these activities should be the responsibility of the nurse. Storing items and rearranging furniture are inappropriate actions because the patient needs be able to consistently locate objects in the immediate environment. The home health nurse discovers that an older patient has been taking her glaucoma eye drops by mouth for the past week. What should the nurse do first? 1. Obtain a prescription for tonometry so that her intraocular pressure can be checked. 2. Try to determine the frequency and the amount that she has been ingesting. 3. Ask her how she decided to take the drops orally instead of instilling them as eye drops. 4. Call the Poison Control Center and be prepared to describe untoward side effects. The correct answer is 2. Try to determine the frequency and the amount that she has been ingesting. Try to find out the amount and frequency that she has been taking the drops by mouth. This information will be needed when calling the ophthalmologist or poison control. A good follow-up question is to try to find out why she is taking the drops by mouth. She may be very confused, or there may have been an error of omission in patient education by all healthcare team members who were involved in the initial prescription. The nurse is assigned to care for a client with a detached retina. Which findings should the nurse expect to be documented in the client's record? 1. Blurred vision. 2. Pain in the affected eye. 3. A yellow discoloration of the sclera. 4. A sense of a curtain falling across the field of vision. The correct answer is 4. A sense of a curtain falling across the field of vision. A characteristic clinical manifestation of retinal detachment described by clients is the feeling that a shadow or curtain is falling across the field of vision. There is no pain associated with detachment of the retina. A retinal detachment is an ophthalmic emergency, and even more so if visual acuity is still normal. Options 1 and 3 are not specifically associated with a detached retina. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. For a patient who has multiple risk factors for primary open-angle glaucoma, which sign or symptom should be investigated as an early sign of POAG? 1. Loss of central visual field. 2. Seeing halos around lights. 3. Mild eye aching. 4. Loss of peripheral vision. The correct answer is 3. Mild eye aching. POAG develops slowly, and irreversible damage to the optic nerve can occur before any signs or symptoms are manifested. However, mild eye aching or headaches should be investigated as possible early signs of POAG. Loss of peripheral vision, seeing halos, and loss of central vision are late signs. A patient has a hordeolum on the right upper eyelid. Which intervention would the nurse recommend first? 1. Apply warm compresses 4 times per day. 2. Gently perform hygienic eyelid scrubs. 3. Obtain a prescription for antibiotic drops. 4. Contact the ophthalmologist. The correct answer is 1. Apply warm compresses 4 times per day. Warm compresses usually provide relief. If the problem persists, eyelid scrubs and antibiotic drops would be appropriate. The ophthalmologist could be consulted, but other providers such as the family physician or the nurse practitioner could give a prescription for antibiotics. The clinic nurse is preparing to test the visual acuity of a client using a Snellen chart. Which of the following identifies the accurate procedure for this visual acuity test? 1. Both eyes are assessed together, followed by the assessment of the right and then the left eye. 2. The right eye is tested, followed by the left eye, and then both eyes are tested. 3. The client is asked to stand at 40 feet from the chart and is asked to read the largest line on the chart. 4. The client is asked to stand at 40 feet from the chart and to read the line that can be read 200 feet away by an individual with unimpaired vision. The correct answer is 2. The right eye is tested, followed by the left eye, and then both eyes are tested. Visual acuity is assessed in one eye at a time, and then in both eyes together, with the client comfortably standing or sitting. The right eye is tested with the left eye covered, then the left eye is tested with the right eye covered. Both eyes then are tested together. Visual acuity is measured with or without corrective lenses, and the client stands at a distance of 20 feet from the chart. A visual acuity test is only one part of a comprehensive ophthalmologic examination. The goal of the visual acuity test is to determine clarity or sharpness of vision. The nurse is reviewing prescriptions for several patients who have disorders of the eye. Which medication prescription is the most important to discuss with the healthcare provider? 1. Timolol for open-angle glaucoma. 2. Cromolyn sodium for allergic conjunctivitis. 3. Atropine for acute angle closure glaucoma. 4. Ranibizumab for wet age-related macular degeneration. The correct answer is 3. Atropine for acute angle closure glaucoma. Atropine should not be used for acute angle closure glaucoma. Atropine causes dilation of the pupil, which impedes outflow of aqueous humor and increases intraocular pressure. This action could precipitate or worsen the condition. After the nurse receives a change of shift report, which patient should be seen first? 1. A 26-year-old patient with thalassemia who has a hemoglobin level of 8 grams per deciliter and orders for a blood transfusion. 2. A 44-year-old patient admitted 3 days previously for sickle cell crisis who is scheduled for a computed tomographic scan. 3. A 50-year-old patient with stage 4 non-Hodgkin lymphoma who is crying and saying, "I'm not ready to die." 4. A 69-year-old patient with chemotherapy-induced neutropenia who has an oral temperature of 100.1 degrees Fahrenheit. The correct answer is 4. A 69-year-old patient with chemotherapy-induced neutropenia who has an oral temperature of 100.1 degrees Fahrenheit. Any temperature elevation in a neutropenic patient may indicate the presence of a life-threatening infection, so actions such as drawing blood for culture and administering antibiotics should be initiated quickly. The other patients need to be assessed as soon as possible, but are not critically ill. When the nurse is assessing a patient with chronic kidney disease who is receiving epoetin alpha injections, which finding most indicates a need to talk with the healthcare provider before giving the medication. 1. Hemoglobin level is 8.9 grams per deciliter. 2. Blood pressure is 198/92. 3. The patient does not like subcutaneous injections. 4. The patient has a history of myocardial infarction. The correct answer is 2. Blood pressure is 198/92. Epoetin alpha can cause hypertension, and blood pressure should be controlled before administering the medication. Because patients with chronic kidney disease have chronic anemia, a hemoglobin level of 8.9 grams per deciliter is not unusual. Although the nurse could ask the HCP about IV administration of the medication, subcutaneous administration requires a lower dose of the medication and is preferred. Epoetin alpha can cause angina or myocardial infarction, but the risk is highest when hemoglobin levels are greater than 11 grams per deciliter. A patient is admitted to the intensive care unit with disseminated intravascular coagulation associated with a gram-negative infection. Which assessment information has the most immediate implications for the patient's care? 1. There is no palpable radial or pedal pulse. 2. The patient reports chest pain. 3. The patient's oxygen saturation is 87%. 4. There is modeling of the hands and feet. The correct answer is 3. The patient's oxygen saturation is 87%. Because the decrease in oxygen saturation will have the greatest immediate effect on all body systems, improvement in oxygenation should be the priority goal of care. The other data also indicate the need for rapid intervention, but improvement of oxygenation is the most urgent need. After a car accident, a patient with a medical alert bracelet indicating hemophilia A is admitted to the emergency department. Which action prescribed by the healthcare provider will the nurse implement first? 1. Transport the patient to the radiology department for cervical spine radiography. 2. Transfuse factor VII concentrate. 3. Type and cross-match for 4 units of packed red blood cells. 4. Infuse normal saline at 250 ml per hour. The correct answer is 2. Transfuse factor VII concentrate. When a hemophiliac patient is at high risk for bleeding, the priority intervention is to maximize the availability of clotting factors. The other prescribed actions should also be implemented rapidly, but do not have as high a priority as administering clotting factors. The nurse is making a room assignment for a newly arrived patient whose laboratory test results indicate pancytopenia. Which patient will be the best roommate for the new patient? 1. Patient with digoxin toxicity. 2. Patient with viral pneumonia. 3. Patient with shingles. 4. Patient with cellulitis. The correct answer is 1. Patient with digoxin toxicity. Patients with pancytopenia are at higher risk for infection. The patient with digoxin toxicity presents the least risk of infecting the new patient. Viral pneumonia, shingles, and cellulitis are infectious processes. These activities are included in the care plan for a 78-year-old patient admitted to the hospital with anemia caused by possible gastrointestinal bleeding. Which activity can the nurse delegate to an experienced assistive personnel? 1. Obtaining stool specimens for the fecal occult blood test. 2. Having the patient sign a colonoscopy consent form. 3. Giving the prescribed polyethylene glycol electrolyte solution. 4. Checking for allergies to contrast dye or shellfish. The correct answer is 1. Obtaining stool specimens for the fecal occult blood test. An experienced AP will have been taught how to obtain a stool specimen for the fecal occult blood test because this is a common screening test for hospitalized patients. Having the patient sign an informed consent form should be done by the healthcare provider who will be performing the colonoscopy. Administering medications and checking for allergies are within the scope of practice of licensed nursing staff. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is providing orientation for a new nurse who is preparing to administer packed red blood cells to a patient who had blood loss during surgery. Which action by the new nurse requires that the nurse intervene immediately? 1. Waiting 20 minutes after obtaining the PRBCs before starting the infusion. 2. Starting an IV line for the transfusion using a 22-gauge catheter. 3. Priming the transfusion set using 5% dextrose in lactated Ringer's solution. 4. Telling the patient that the PRBCs may cause a serious transfusion reaction. The correct answer is 3. Priming the transfusion set using 5% dextrose in lactated Ringer's solution. Normal saline, an isotonic solution, should be used when priming the IV line to avoid causing hemolysis of red blood cells. Ideally, blood products should be infused as soon as possible after they are obtained. However, a 20-minute delay would not be unsafe. Large-bore IV catheters are preferable for blood administration. If a smaller catheter must be used, normal saline may be used to dilute the RBCs. Although the new nurse should avoid increasing patient anxiety by indicating that a serious transfusion reaction may occur, this action is not as high a concern as using an inappropriate fluid for priming the IV tubing. A patient with chemotherapy-related neutropenia is receiving filgrastim injections. Which finding by the nurse is most important to report to the healthcare provider? 1. The patient says, "My bones are aching." 2. The patient's platelet count is 110,000 cubic milliliters. 3. The patient's white blood cell count is 39,000 cubic milliliters. 4. The patient reports that the medication stings when it is injected. The correct answer is 3. The patient's white blood cell count is 39,000 cubic milliliters. Leukocytosis is an adverse effect of filgrastim and indicates a need to stop the medication or decrease dosage. Bone pain is a common adverse effect as the bone marrow starts to produce more neutrophils. The patient should receive analgesics, but the medication will be continued. Stinging with injection may occur. The nurse should administer the medication more slowly. The patient's platelet count is low and should be reported, but the level of 110,000 cubic milliliters does not increase risk for spontaneous bleeding. When administering a blood transfusion to a patient, which action can the nurse delegate to the assistive personnel? 1. Take the patient's vital signs before the transfusion is started. 2. Ensure that the blood is infused within no more than 4 hours. 3. Ask the patient at frequent intervals about the presence of chills or dyspnea. 4. Assist with double-checking the patient's identification and blood bag number. The correct answer is 1. Take the patient's vital signs before the transfusion is started. AP education and role includes obtaining vital signs, which will be reported to the nurse before the initiation of the transfusion. Monitoring for transfusion reactions, adjusting the transfusion rate, and ensuring that the blood type and number are correct require critical thinking and should be done by the nurse. A patient who has sickle cell disease is admitted with vaso-occlusive crisis and reports severe abdominal and flank pain. Which of the analgesic medications on the pain treatment protocol will be best for the nurse to administer initially? 1. Ibuprofen 800 mg PO. 2. Morphine sulfate 4 mg IV. 3. hydromorphone liquid 5 mg PO. 4. Fentanyl 25 micrograms per hour transdermal patch. The correct answer is 2. Morphine sulfate 4 mg IV. Guidelines for the management of vaso-occlusive crisis suggest the rapid use of parenteral opioids for patients who have moderate to severe pain. The other medications may also be appropriate for the patient as the crisis resolves, but are not the best choice for rapid treatment of severe pain.
The emergency department nurse is calling to report on a patient who will be admitted to the acute psychiatric unit. He has a history of bipolar disorder and was in an altercation that resulted in the death of another. He has contusions, abrasions, and minor lacerations. What is the priority question that the receiving nurse should ask? 1. When will the patient be transferred? 2. Will a police officer be with him while he is on the unit? 3. Why isn't the patient being admitted to the trauma unit? 4. What is the patient's current mood and behavior? The correct answer is 4. What is the patient's current mood and behavior? Rationale: knowing the current mood and behavior is the priority, so that the nurse can prepare for physical or chemical restraints, isolation or a private room, and allocation and assignment of staff members. The other questions are also relevant. However, the nurse should be aware that challenging the appropriateness of the psychiatric unit versus the trauma unit requires contacting the nursing supervisor, because the emergency department nurse will not be able to resolve this issue. A well-known celebrity is admitted to the psychiatric unit. Several nurses from other units drop by and express an interest in seeing the patient. What is the best response? 1. Please be discreet and do not interrupt the workflow. 2. How did you find out that the patient was admitted to this unit? 3. Please wait. I need to call the nursing supervisor about this request. 4. I'm sorry, the patient has asked that only family be allowed to visit. The correct answer is 2. How did you find out that the patient was admitted to this unit? Rationale: determine how the nurses found out about the patient's admission. This is a serious Health Insurance Portability and Accountability Act violation, and information disclosure must be immediately stopped. Unfortunately for these nurses, administration will have to be notified, but as a professional courtesy, it would be better if they went directly to the supervisor and admitted the error rather than immediately calling the supervisor and reporting them. Which task can be delegated to a medical surgical assistive personnel who has been temporarily floated to the acute psychiatric unit to help? 1. Performing one-to-one observation of a patient who is suicidal. 2. Assisting the occupational therapist to conduct a craft class. 3. Accompanying an older adult patient who wanders on a walk outside. 4. Assisting the medication nurse who is having problems with a patient. The correct answer is 3. Accompanying an older adult patient who wanders on a walk outside. Rationale: medical surgical APs assist patients to ambulate, and they frequently care for older confused patients. Performing one-to-one suicide watch requires experience to recognize behaviors and to immediately alert the nurse and intervene. Assisting the occupational therapist or medication nurse may be possible, but the medical surgical AP is unlikely to be familiar with the behavioral interventions required in these situations. A patient on the acute psychiatric unit develops neuroleptic malignant syndrome. Which task would be delegated to the psychiatric nursing assistant? 1. Wiping the patient's body with cool moist towels. 2. Monitoring and interpreting vital signs every 15 minutes. 3. Attaching the patient to the electrocardiogram monitor. 4. Transporting the patient to the medical intensive care unit. The correct answer is 1. Wiping the patient's body with cool moist towels. Rationale: a PNA can perform this simple cooling measure with minimal instruction. Neuroleptic malignant syndrome is a rare, but potentially fatal reaction to antipsychotic medication. Symptoms include fever, altered mental status, muscle rigidity, and autonomic instability. The nurse should continuously interpret vital signs, although taking vital signs can be delegated. Assistive personnel in the ICU and emergency department will be familiar with how to attach ECG leads, but PNAs will rarely have occasion to use this equipment, therefore, the nurse should perform this task. The nurse should accompany the patient to the ICU, although the PNA could assist. A patient comes into the walk-in clinic and tells the nurse that he would like to be admitted to an alcohol rehabilitation program. Which question is the most important to ask? 1. What made you decide to enter a program at this time? 2. How much alcohol do you usually consume in a day? 3. When was the last time you had a drink? 4. Have you been in a rehabilitation program before? The correct answer is 3. When was the last time you had a drink? Rationale: before someone enters an alcohol rehabilitation program, there should be a medically supervised detoxification. This patient has walked in off the street, therefore, the nurse must determine whether he is at risk for withdrawal symptoms. Withdrawal from alcohol can be life-threatening. The other questions are relevant and are likely to be included in the interview. The patient has a panic disorder and is having difficulty controlling his anxiety. Which symptoms are cause for greatest concern? 1. His heart rate is increased, and he reports chest tightness. 2. He demonstrates tachypnea and carpopedal spasms. 3. He is pacing and pounding his fists together. 4. He is muttering to himself and is easily startled. The correct answer is 3. He is pacing and pounding his fists together. Rationale: all of these symptoms signal an increase of anxiety. However, physically aggressive behavior signals a danger to others and to self. Verbal intervention is still possible, but the pacing and fist pounding are a step above the other symptoms. Tachycardia and chest tightness are assessed but should abate as the patient becomes less anxious. Carpopedal spasms occur during hyperventilation. Assisting the patient to breathe in a paper bag will help. Muttering to self can be interrupted by using a normal conversational tone and topic. A patient diagnosed with paranoid schizophrenia says, "Dr. Smith has killed several other patients, and now he is trying to kill me." What is the best response? 1. I have worked here a long time, no one has died, you are safe here. 2. What has Dr. Smith done to make you think he would like to kill you? 3. All of the staff, including Dr. Smith, are here to ensure your safety. 4. Whenever you are concerned or nervous, talk to me or any of the nurses. The correct answer is 4. Whenever you are concerned or nervous, talk to me or any of the nurses. Rationale: the nurse can acknowledge the patient's fears without agreeing or disagreeing with his accusation. Directing him to talk to the nursing staff provides a source of emotional support and an action that he can use to decrease his anxiety. Telling the patient that no one has died and that the staff will ensure safety is presenting reality. However, he has a delusional belief and arguments should be avoided. Asking him to explain his rationale for his beliefs encourages him to elaborate on his delusion. There is a patient on the rehabilitation unit who has been there for several months. He is hostile, rude, and belligerent, and no one likes to interact with him. How should the charge nurse handle the assignment? 1. Rotate the assignment schedule, so that no one has to care for him more than once or twice a week. 2. Pair a float nurse and a nursing student, and assign this team to care for the patient. They will have a fresh perspective. 3. Identify several experienced nurses as primary caregivers, and develop a plan that includes psychosocial interventions. 4. Assign self as primary caregiver and role model, how patients should be treated. The correct answer is 3. Identify several experienced nurses as primary caregivers, and develop a plan that includes psychosocial interventions. Rationale: this patient has trouble with interpersonal interactions, so consistent caregivers who use psychosocial interventions have the best chance of developing a functional nurse-patient relationship. Rotating the assignment sheet to give the staff a break, and using float staff are frequent strategies that are used, but these are not necessarily the best for the patient. Taking the patient may seem like the easiest solution for the charge nurse, but in the long run, strengthening and supporting the staff are better strategies. A patient who was recently diagnosed with conversion disorder is experiencing a sudden loss of vision after witnessing a violent fight between her husband and adult-age son. What is the priority therapeutic approach to use with this patient? 1. Reassure her that her blindness is temporary and will resolve with time. 2. Gently point out that she can see well enough to function independently. 3. Encourage expression of feelings and link emotional trauma to the blindness. 4. Teach ways to cope with blindness, such as methodically arranging personal items. The correct answer is 4. Teach ways to cope with blindness, such as methodically arranging personal items. Rationale: patients with conversion disorders are experiencing symptoms, even though there is no identifiable organic cause. Therefore, the patient should be assisted in learning ways to cope and live with the disability. The patient may physically be able to see, but pointing this out is not helpful. Encouraging the expression of feelings is okay, but it is premature to expect the patient to link the fight to her blindness. It is likely that the sudden onset of blindness will resolve, but the priority therapeutic approach is teaching her ways to cope in the meantime. What is the nurse's most important role in helping patients who have schizophrenia to benefit from a comprehensive approach that includes medication and multidisciplinary non-drug therapies? 1. Help identify patients who would benefit from conventional psychotherapy. 2. Refer patients to a psychiatric nurse specialist for education about the disease. 3. Suggest that patients talk to vocational specialists for additional training. 4. Establish a therapeutic relationship with patients and encourage participation. The correct answer is 4. Establish a therapeutic relationship with patients and encourage participation. Rationale: the nurse and the psychiatric nursing assistant spend more time with the patients than any of the other members of the healthcare team. Thus, establishing a good therapeutic relationship is essential to building trust, increasing social skills, encouraging medication adherence, and suggesting participation in educational, socialization, and vocational opportunities. Conventional psychotherapy is generally not used with patients with schizophrenia.
The staff nurse is working with a student nurse to provide care for a 10-year-old patient with severe abdominal, hip, and knee pain caused by a sickle cell crisis. Which action taken by the student requires the staff nurse to intervene immediately? 1. Administering oral pain medication as needed. 2. Positioning cold packs on the child's knees. 3. Encouraging increased fluid intake. 4. Monitoring vital signs every 2 hours. The correct answer is 2. Positioning cold packs on the child's knees. Sickle cell crisis may include vaso-occlusive crisis, splenic sequestration, and aplastic crisis. The symptoms experienced by this child are indicative of both vaso-occlusive crisis and splenic sequestration. Placing cold packs on the knees of a child with vaso-occlusive crisis results in vasoconstriction, placing the child at risk for thrombosis formation. Encouraging increased fluid intake is advised to prevent thrombosis formation. Monitoring vital signs is a method to assess for life-threatening complications associated with both vaso-occlusive crisis and splenic sequestration. Vaso-occlusive crisis is associated with severe pain, and pain medication is recommended. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. After receiving the change of shift report, which patient should the nurse assess first? 1. An 18-month-old patient with coarctation of the aorta who has decreased pedal pulses. 2. A 3-year-old patient with rheumatic fever who reports severe knee pain. 3. A 5-year-old patient with endocarditis who has crackles audible throughout both lungs. 4. An 8-year-old patient with Kawasaki disease who has a temperature of 102.2 degrees Fahrenheit. The correct answer is 3. A 5-year-old patient with endocarditis who has crackles audible throughout both lungs. Crackles throughout both lungs indicate that the child has severe left ventricular failure as a complication of endocarditis. Hypoxemia is likely, so the child needs rapid assessment of oxygen saturation, initiation of supplemental oxygen delivery, and administration of medications such as diuretics. The other children should also be assessed as quickly as possible, but they are not experiencing life-threatening complications of their medical diagnoses. The nurse obtains this information when assessing a 3-year-old patient with uncorrected tetralogy of Fallot who is crying. Which finding requires immediate action? 1. The apical pulse rate is 118 beats per minute. 2. A loud systolic murmur is heard in the pulmonic area. 3. There is marked clubbing of the child's nail beds. 4. The lips and oral mucosa are dusky in color. The correct answer is 4. The lips and oral mucosa are dusky in color. Circumoral cyanosis indicates a drop in the partial pressure of oxygen that may precipitate seizures and loss of consciousness. The nurse should rapidly place the child in a knee-chest position, administer oxygen, and take steps to calm the child. The other assessment data are expected in a child with congenital heart defects, such as tetralogy of Fallot. An adolescent with cystic fibrosis is admitted to the pediatric unit with increased shortness of breath and pneumonia. Which nursing activity is most important to include in the patient's care? 1. Allowing the adolescent to decide if aerosolized medications are needed. 2. Scheduling postural drainage and a chest physiotherapy every 4 hours. 3. Placing the adolescent in a room with another adolescent with CF. 4. Encouraging oral fluid intake of 2,400 milliliters per day. The correct answer is 2. Scheduling postural drainage and a chest physiotherapy every 4 hours. National guidelines indicate that airway clearance techniques are critical for patients with CF. Thus, postural drainage and chest physiotherapy are a priority. National guidelines also indicate that children and adolescents with CF who are hospitalized with respiratory illnesses should be placed on contact precautions. Furthermore, people with CF should be separated from others with CF to reduce droplet transmission of CF pathogens. There is no evidence that increased fluid intake adequately thins respiratory secretions, and chest physiotherapy is the priority. An unimmunized 7-year-old child who attends a local elementary school contracts rubeola. The child has 2 siblings, ages 9 and 11 years, who also attend the elementary school. Which action by the school nurse is a priority? 1. Exclude the child and siblings from attending school for 21 days. 2. Notify all parents of children attending the school of the exposure. 3. Recommend that the siblings receive the measles vaccine. 4. Recommend that the siblings receive measles immunoglobulin. The correct answer is 1. Exclude the child and siblings from attending school for 21 days. Rubeola is a highly contagious infectious disease with severe consequences that include death. The Centers for Disease Control and Prevention reports that 9 of 10 susceptible people with close contact to a person with measles will contract the disease. The incubation period is 7 to 21 days. Excluding the infected and exposed children during this period of time is a priority to prevent exposure of healthy children enrolled in the elementary school. Although it is important to notify the parents of the other children in the school of the exposure, limiting exposure of other children is the priority. Mumps, measles, and rubella vaccine administered within 72 hours of initial measles exposure and immunoglobulin administered within 6 days of exposure may provide some protection or modify the clinical course of the disease in unimmunized children. However, the priority is to prevent an epidemic by limiting exposure. A 21-year-old woman at 8 weeks gestation tells the nurse she has obtained marijuana from the town's marijuana dispensary to help her with the nausea she is experiencing. Which action would be the priority? 1. Inform the patient that there are other treatments for nausea in pregnancy. 2. Advise the patient that marijuana may have deleterious effects on the neurologic development of the fetus. 3. Teach the patient that inhaled marijuana will have a more rapid effect than edible marijuana products. 4. Inform the patient that marijuana is thought to be an effective remedy for nausea. The correct answer is 2. Advise the patient that marijuana may have deleterious effects on the neurologic development of the fetus. There is evidence that marijuana used during pregnancy can be linked to impaired neurologic development in the fetus and learning and behavioral issues in the child exposed to marijuana in the prenatal period. The first priority would be to prevent harm and to begin educating the mother of the potential risks of marijuana use in pregnancy. It would then be appropriate to provide information to her of other potential treatments for her nausea. The goal would be to educate the woman of the risks and to provide an alternative, safer treatment. It is true that inhaled marijuana will have a quicker action and that some studies have found marijuana to be effective in the treatment of nausea. However, that is not priority information for her at this time. A 7-month-old infant arrives at the health center for a scheduled well-child visit. When the nurse approaches the infant to obtain vital signs, the infant cries vigorously and clings fearfully to the mother. Which of the following phenomena provides the best explanation for the infant's behavior? 1. Separation anxiety. 2. Dissociation disorder. 3. Stranger anxiety. 4. Autism spectrum. The correct answer is 3. Stranger anxiety. This infant is displaying stranger anxiety. The child becomes anxious when exposed to unfamiliar people. Separation anxiety occurs when the child is separated from the primary caregiver. Anxiety and crying are also common behaviors. Stranger anxiety and separation anxiety are concurrent and generally begin at 7 to 8 months of age. A 30-year-old Gravida 6, Para 5 woman at 12 weeks gestation has just begun prenatal care, and her initial laboratory work reveals that she has tested positive for human immunodeficiency virus infection. Which information would be priority evidence-based nursing education for this patient today? 1. Medication for HIV infection is safe and can greatly reduce transmission of HIV to the infant. 2. Breastfeeding is still recommended because of the great benefits to the infant. 3. Pregnancy is known to accelerate the course of HIV disease in the mother. 4. Cesarean section is not recommended because of the increased risk of HIV transmission with the bleeding at surgery. The correct answer is 1. Medication for HIV infection is safe and can greatly reduce transmission of HIV to the infant. Administration of antiviral medications to the pregnant woman and the newborn cesarean birth if HIV RNA levels are greater than 1,000 copies per milliliter, and avoidance of breastfeeding have reduced the incidence of perinatal transmission of HIV from approximately 26% to between 1% to 2%. Pregnancy is not known to accelerate HIV disease in the mother. The most important nursing action is to engage the mother in prenatal care and educate her as to the great benefits of medication for HIV during pregnancy. A 22-year-old Gravida 1, Para 0 woman is being given an epidural anesthetic for pain control during labor and birth. Which are appropriate nursing actions when epidural anesthesia is used during labor? Select all that apply. 1. Request the anesthesiologist to discontinue the epidural anesthetic when the patient's cervix is completely dilated to allow the patient to sense the urge to push. 2. Insert an indwelling catheter because the woman is likely to be unable to void. 3. Encourage ambulation to encourage descent of the fetal head. 4. Encourage the patient to turn from side to side during the course of labor. 5. Teach the patient that pain relief can be expected to last 1 to 2 hours. 6. Explain to the patient that she will feel very drowsy after the epidural is given. The correct answers are 2. Insert an indwelling catheter because the woman is likely to be unable to void, and 4. Encourage the patient to turn from side to side during the course of labor. Insertion of an indwelling catheter is indicated because the woman will usually be unable to void because of the effect of the anesthetic in the bladder area. Positioning the patient on her side enhances blood flow and helps to prevent hypotension. Changing maternal position encourages progress in labor. With epidural anesthesia, ambulation is not usually an option due to decreased sensation in the legs. It is not recommended to routinely discontinue an epidural anesthetic at complete dilation A continuous epidural infusion provides pain relief throughout labor and birth. Drowsiness is not a common side effect with epidural anesthesia. Drowsiness would be more likely with the use of IV narcotics for pain relief in labor. Use of evidence-based practices with a laboring woman supports the perinatal core measure of reducing the percentage of women who are delivered by cesarean section. While assessing a 29-year-old Gravida 2, Para 2 patient who had a normal spontaneous vaginal delivery 30 minutes ago, the nurse notes a large amount of red vaginal bleeding. Which nursing action would be the priority? 1. Check vital signs. 2. Notify the healthcare provider. 3. Firmly massage the uterine fundus. 4. Put the baby to breast. The correct answer is 3. Firmly massage the uterine fundus. Fundal massage would be the priority nursing action because it helps the uterus to contract firmly and thus reduces bleeding. The first two answer choices are appropriate nursing actions, but do nothing to stop the immediate bleeding. Putting the baby to the breast does release oxytocin, which causes uterine contraction, but it will be slower to do so than fundal massage. A 26-year-old Gravida 1, Para 1 patient who underwent a cesarean section 24 hours ago tells the nurse that she is having some trouble breastfeeding. Which tasks could be appropriately delegated to the assistive personnel on the postpartum floor? Select all that apply. 1. Providing the mother with an ordered abdominal binder. 2. Assisting the mother with breastfeeding. 3. Taking the mother's vital signs. 4. Checking the amount of lochia present. 5. Assisting the mother with ambulation. 6. Checking the incision site. The correct answers are 1. Providing the mother with an ordered abdominal binder. 3. Taking the mother's vital signs. And 5. Assisting the mother with ambulation. The AP could provide an abdominal binder, measure the vital signs of the patient, and assist her to ambulate. The nurse would be responsible for evaluating the normality of the vital sign values. The AP should be given parameter limits for vital signs and told to report values outside these limits to the nurse. Assisting in breastfeeding for a first-time mother is a very important nursing function because the nurse needs to give consistent, evidence-based advice to enhance success at breastfeeding. A common complaint of postpartum patients is inconsistent help with and advice on breastfeeding. The nurse should also be the one to check the amount of lochia and the surgical incision site because the evaluation requires nursing judgment. The use of the professionally educated nurse to provide evidence-based and consistent information and assistance with breastfeeding supports the perinatal core measure of increasing the percentage of newborns who are fed breast milk only. The nurse identified late fetal heart decelerations and decreased variability in the fetal heart rate of a woman in active labor and notified the healthcare provider on call, who advised the nurse that the pattern is acceptable. What would be the priority action at this time? 1. Advise the patient that a different HCP will be called because the first HCP's response was not adequate. 2. Discuss the concerns with another labor and delivery nurse. 3. Document the conversation with the HCP accurately, including the HCP's interpretation and recommendation, and continue close observation of the fetal heart rate. 4. Go up the chain of command and communicate the assessment of the fetal heart rate findings clearly to the next appropriate person per unit protocol. The correct answer is 4. Go up the chain of command and communicate the assessment of the fetal heart rate findings clearly to the next appropriate person per unit protocol. The nurse must follow through on the findings of a non-reassuring fetal heart rate. When patient safety is concerned, the nurse is obligated to pursue an appropriate response. Documenting the conversation with the HCP and discussing it with a colleague are appropriate, but something must be done to address the immediate safety concern and possible need for intervention at this time. The nurse must persist until the safety concern has been addressed appropriately. Which action would best demonstrate evidence-based nursing practice in the care of a patient who is 1 day postpartum and reporting nipple soreness while breastfeeding? 1. Inform the mother that a certain amount of soreness is normal. 2. Assess the mother-baby couplet for nursing position and latch and correct as indicated. 3. Advise the use of a breast pump until nipple soreness resolve. 4. Advise alternating breastfeeding and pumping to avoid excess sucking at the nipple. The correct answer is 2. Assess the mother-baby couplet for nursing position and latch and correct as indicated. Improper latch and position are the most common causes of nipple soreness and can be corrected with assessment and assistance to the mother. This practice supports the perinatal core measure of increasing the percentage of newborns who are fed breast milk only. Advising the mother that soreness can be normal does not provide any assessment or assistance to the mother with her problem. Using a pump may be appropriate at some times during lactation, but the first priority is to assess and correct the issue that is causing the soreness. Several patients have just come into the obstetric triage unit. Which patient should the nurse assess first? 1. A 17-year-old Gravida 1, para-0 woman at 40 weeks gestation with contractions every 6 minutes who is crying loudly and is surrounded by anxious family members. 2. A 22-year-old G3P2 woman at 38 weeks gestation with contractions every 3 minutes who is requesting to go to the bathroom to have a bowel movement. 3. A 32-year-old G4P3 woman at 27 weeks gestation who noted vaginal bleeding today after intercourse. 4. A 27-year-old G2P1 woman at 37 weeks gestation who experienced spontaneous rupture of membranes 30 minutes ago but feels no contractions. The correct answer is 2. A 22-year-old G3P2 woman at 38 weeks gestation with contractions every 3 minutes who is requesting to go to the bathroom to have a bowel movement. A multiparous patient in active labor with an urge to have a bowel movement will probably give birth imminently. She needs to be the first assessed. The healthcare provider must be notified immediately, and the patient must be moved to a safe location for the birth. She should not be allowed to go to the bathroom at this time. The other patients all have needs requiring prompt assessment, but the imminent birth takes priority. Vaginal bleeding after intercourse could be caused by cervical irritation or a vaginal infection, or could have a more serious cause such as placenta previa. Which statement by the student nurse to the 21-year-old pregnant woman who smokes would require the supervising nurse to intervene? 1. Pregnancy is an excellent time to quit smoking. 2. Vaping instead of smoking during pregnancy is less risky. 3. You should not allow anyone to smoke around you during pregnancy. 4. You should not allow anyone to smoke around the baby when she is born. The correct answer is 2. Vaping instead of smoking during pregnancy is less risky. The nurse would need to intervene to correct erroneous information being given to the patient. Vaping is not safer than smoking in pregnancy. Babies born to mothers who vape have levels of nicotine exposure, low birth weight, and shortened gestational age equal to infants born to mothers who smoke. Clear advice about pregnancy being an excellent time to quit and then providing resources to do so is appropriate education. Advising the mother to avoid secondhand smoke during the pregnancy and after delivery is appropriate advice.
Which patient should the charge nurse assign to a newly graduated nurse who is orientating to the neurologic care unit? 1. A 28-year-old newly admitted patient with a spinal cord injury. 2. A 67-year-old patient who had a stroke 3 days ago and has left-sided weakness. 3. An 85-year-old patient with dementia who is to be transferred to long-term care today. 4. A 54-year-old patient with Parkinson's disease who needs assistance with bathing. The correct answer is 2. A 67-year-old patient who had a stroke 3 days ago and has left-sided weakness. Rationale: the newly graduated nurse who is on orientation to the unit should be assigned to care for patients with stable, non-complex conditions, such as the patient with stroke. The task of helping the patient with Parkinson's disease to bathe is best delegated to the assistive personnel. The patient being transferred to the nursing home and the newly admitted patient with a spinal cord injury should be assigned to nurses with experience in neurological nursing care.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
At 9 p.m., the nurse admits a 63-year-old patient with a diagnosis of acute myocardial infarction. Which finding is most important to communicate to the healthcare provider, who is considering the use of fibrinolytic therapy with tissue plasminogen activator for the patient? 1. The patient was treated with alteplase about 8 months ago. 2. The patient takes famotidine for gastroesophageal reflux disease. 3. The patient has ST segment elevations on the electrocardiogram. 4. The patient reports having continuous chest pain since 8 a.m. The correct answer is 4. The patient reports having continuous chest pain since 8 a.m. Rationale: because continuous chest pain lasting for more than 12 hours indicates that reversible myocardial injury has progressed to irreversible myocardial necrosis. Fibrinolytic drugs are usually not recommended for patients with chest pain that has lasted for more than 12 hours. The other information is also important to communicate, but would not impact the decision about alteplase use. The clinic nurse is evaluating a patient who had coronary artery stenting through the right femoral artery a week previously and is taking metoprolol, clopidogrel, and aspirin. Which information reported by the patient is most important to report to the healthcare provider? 1. Patient is experiencing shortness of breath and fatigue. 2. Bruising is present at the right groin. 3. Home blood pressure today was 104/52. 4. Home radial pulse rate has been 55 to 60 beats per minute. The correct answer is 1. Patient is experiencing shortness of breath and fatigue. Rationale: shortness of breath and fatigue may indicate anemia from gastrointestinal bleeding, which is a possible adverse effect of both aspirin and clopidogrel. The patient will need to continue on the medications, but may need treatment with proton pump inhibitors or histamine 2 blockers to decrease risk for gastrointestinal bleeding. The other findings will also be reported to the healthcare provider, but will not require a change in the therapeutic plan for the patient.
An older patient had ranibizumab injected into his eye for treatment of wet, age-related macular degeneration several days ago. He is now experiencing redness, light sensitivity, and pain. Which advice would the nurse give to the patient? 1. These are common side effects that should pass after a few more days. 2. Contact the healthcare provider immediately for possible eye infection. 3. Rest eyes as much as possible and wear sunglasses if lights are too bright. 4. Inform the HCP before the next treatment so that the dosage can be adjusted. The correct answer is 2. Contact the healthcare provider immediately for possible eye infection. Ranibizumab is an angiogenesis inhibitor that is directly injected into the vitreous humor of the eye. The purpose of the medication injection is to inhibit the growth of new blood vessels in patients who have neovascular age-related macular degeneration. The biggest concern about adverse effects of the treatment is endophthalmitis. This can be caused by bacteria, virus, or fungus. Redness, light sensitivity, or pain are signs of possible endophthalmitis that should be immediately reported to the provider. The nurse is supervising a new nurse who has just finished assessing a patient for redness and discomfort to the right eye. The new nurse documents visual acuity NA. Which action would the supervising nurse take? 1. Do nothing. The documentation is minimal but acceptable. 2. Ask her to explain the rationale for the documentation. 3. Reassess the patient's eye and vision to validate findings. 4. Suggest contacting the clinical educator for documentation tips. The correct answer is 2. Ask her to explain the rationale for the documentation. Asking the nurse to explain the documentation is a way of assessing her knowledge of documentation, her understanding of how the patient's report guides the focused assessment, and her understanding of the use of abbreviations. The nurse may have a good reason for charting NA, but a reader could misunderstand. For example, visual acuity NA could be interpreted as the nurse making a clinical judgment that assessing vision was not applicable for this patient. The documentation is not acceptable because the patient's report indicates that vision should be tested if at all possible. Redoing the assessment does not help the nurse to correct mistakes. Contacting the educator for assistance is an option that is based on assessment of her rationale. Which patients would be best to assign to the most experienced nurse in an ambulatory care center that specializes in vision problems and eye surgery? Select all that apply. 1. Patient who requires post-operative instructions after cataract surgery. 2. Patient who needs an iPad and a metal shield applied. 3. Patient who requests a home health referral for dressing changes and eye drop installation. 4. Patient who needs teaching about self-administration of eye drop. 5. Patient who requires an assessment for recent and sudden loss of sight. 6. Patient who requires preoperative teaching for laser trabeculoplasty. The correct answers are 1. Patient who requires post-operative instructions after cataract surgery. 3. Patient who requests a home health referral for dressing changes and eye drop installation. 5. Patient who requires an assessment for recent and sudden loss of sight. And 6. Patient who requires preoperative teaching for laser trabeculoplasty. Providing post-operative and preoperative instructions, making home health referrals, and assessing for needs related to loss of vision should be done by an experienced nurse who can give specific details and specialized information about follow-up eye care and adjustment to loss. The principles of applying an iPad and shield and teaching the administration of eye drops are basic procedures that should be familiar to all nurses. A nursing student is assisting an older patient who has decreased vision related to macular degeneration. The patient is alert, conversant, and cognitively intact. When would the supervising nurse intervene? 1. Student puts the call bell and personal items within reach and locates each item by guiding the patient's hand. 2. Student closes the curtains and turns off all of the lights at the end of the shift to encourage rest and sleep. 3. Student talks to the patient about family and asks, "So, when was the last time that you saw your uncle?" 4. Student assists during mealtime by opening packages and describing location of foods by using clock coordinates. The correct answer is 2. Student closes the curtains and turns off all of the lights at the end of the shift to encourage rest and sleep. For patients who retain some vision, the room should be well lit. Even at night, there should be a nightlight. Other options are correct actions. Words such as see, look, or view are parts of normal speech, and it's acceptable and natural to use these terms. A client sustains a chemical eye injury from a splash of battery acid. The nurse should prepare the client for which immediate measure? 1. Checking visual acuity. 2. Covering the eye with a pressure patch. 3. Swabbing the eye with antibiotic ointment. 4. Irrigating the eye with sterile normal saline. The correct answer is 4. Irrigating the eye with sterile normal saline. Emergency care after a chemical burn to the eye includes irrigating the eye immediately with sterile normal saline or ocular irrigating solution. The irrigation should be maintained for at least 10 minutes. After this emergency treatment, visual acuity is assessed. Options 2 and 3 are not immediate measures. The nurse is on a camping trip. A man who is chopping wood gets struck in the eye with a piece of debris. On examination, a wood splinter is protruding from his eyeball. What should the nurse do first? 1. Have the man lie in the back seat of the car and drive him to the emergency department. 2. Gently remove the piece of wood and place a sterile dressing over the eye. 3. Carefully rest a plastic cup on the orbital rim and tape it in place. 4. Flush the eye with copious amounts of clean tepid water, then check visual acuity. The correct answer is 3. Carefully rest a plastic cup on the orbital rim and tape it in place. Penetrating objects should not be removed or disturbed by anyone except an eye specialist because the object may be creating a tamponade effect. Removing or disrupting the object could result in additional damage to the eye. The man needs to have emergency care, and 911 should be called. But if there are no emergency services available, the man should sit in the back seat of the car with a seatbelt in place for transport to the nearest facility. If an eye has been cut or punctured, the bottom of a paper cup taped to the bones surrounding the eye can serve as a shield until you get medical attention. After a penetrating eye injury has been assessed and treated by an ophthalmologist, there is a possibility that based on the ophthalmologist recommendations, foreign body removal, flushing, and dressing application could be accomplished in the emergency department. However, penetrating objects frequently require surgical removal. Antibiotics and a tetanus immunization are administered before the patient is transferred to the operating room. According to evidence-based guidelines from the American Optometric Association, which patient needs to have an annual eye examination? 1. 18-year-old who is asymptomatic and has low risk. 2. 40-year-old who is asymptomatic and has low risk. 3. 55-year-old who is asymptomatic and has low risk. 4. 67-year-old who is asymptomatic and has low risk. The correct answer is 4. 67-year-old who is asymptomatic and has low risk. People 65 years or older are advised to have eye examinations annually or even more frequently, even if they have low risk. People who are 18 to 64 years old with low risk are advised to have eye examinations at least every 2 years. Examples of risk factors include family history for eye disease, systemic health conditions that affect the eyes, such as diabetes, racial or ethnic backgrounds with increased risk, such as African Americans, occupations that are eye hazardous, prescription or non-prescription drugs with ocular side effects, contact lenses, previous eye surgery or eye injury, and having functional vision in only one eye. After cataract surgery, which symptom needs to be immediately reported to the healthcare provider? 1. A scratchy sensation in the operative eye. 2. Loss of depth perception with the patch in place. 3. Poor vision 6 to 8 hours after patch removal. 4. Pain not relieved by prescribed medication. The correct answer is 4. Pain not relieved by prescribed medication. Pain may signal hemorrhage, infection, or increased ocular pressure. A scratchy sensation and loss of depth perception with the patch in place are common. Adequate vision may not return for 24 hours. Which finding should be immediately reported to the healthcare provider? 1. A change in color vision. 2. Crusty yellow drainage on the eyelashes. 3. Increased lacrimation. 4. A curtain-like shadow across the visual field. The correct answer is 4. A curtain-like shadow across the visual field. A curtain-like shadow is a symptom of retinal detachment, which is an emergency situation. A change in color vision is a symptom of a cataract. Crusty drainage is associated with conjunctivitis. Increased lacrimation is associated with many eye irritants, such as allergies, contact lenses, or foreign bodies. A patient calls the clinic and reports redness of the sclera, itching of the eyes, and increased lacrimation for several hours. What should the nurse direct the caller to do first? 1. Please call your healthcare provider. 2. Apply a cool compress to your eyes. 3. If you are wearing contact lenses, remove them. 4. Take an over-the-counter antihistamine. The correct answer is 3. If you are wearing contact lenses, remove them. If the patient is wearing contact lenses, the lenses may be causing the symptoms, and removing them will prevent further eye irritation or damage. Policies on giving telephone advice vary among institutions, and knowledge of the facility policy is essential. The other options may be appropriate, but additional information is needed before suggesting anything else. According to evidence-based guidelines from the American Optometric Association, which modifiable risk factor is the most important to emphasize during patient teaching to reduce the risk for age-related macular degeneration? 1. Initiate smoking cessation. 2. Take vitamin D and E supplements. 3. Eat dark green, leafy vegetables. 4. Wear protective eyewear as needed. The correct answer is 1. Initiate smoking cessation. According to the American Optometric Association, smoking cessation is the most important modifiable factor for decreasing risk for age-related macular degeneration. Consumption of dark green vegetables and use of vitamin supplements are recommended, but the evidence is less compelling. Use of protective eyewear is recommended to prevent eye injuries during active sports or hazardous occupations, but this preventative measure is not related to age-related macular degeneration. A 22-year-old patient with stage 1 Hodgkin disease is admitted to the oncology unit for radiation therapy. During the initial assessment, the patient tells the nurse, "Sometimes I'm afraid of dying." Which response is most appropriate at this time? 1. Many individuals with this diagnosis have some fears. 2. Perhaps you should ask the doctor about medication. 3. Tell me a little bit more about your fear of dying. 4. Most people with stage 1 Hodgkin disease survive. The correct answer is 3. Tell me a little bit more about your fear of dying. More assessment about what the patient means is needed before any interventions can be planned or implemented. All of the other statements indicate an assumption that the patient is afraid of dying of Hodgkin disease, which may not be the case. A patient with iron deficiency anemia who is taking oral iron supplements is evaluated by the nurse in the outpatient clinic. Which finding by the nurse is of most concern? 1. The patient reports that stools are black. 2. The patient complains of occasional constipation. 3. The patient takes a multivitamin tablet every day. 4. The patient takes an antacid with the iron to avoid nausea. The correct answer is 4. The patient takes an antacid with the iron to avoid nausea. Concurrent use of antacids with iron supplements will decrease absorption of the iron and decrease the efficacy in resolving the patient's anemia. Black stools are expected when taking oral iron. The patient's occasional constipation may indicate a need for information about prevention of constipation while taking iron. Use of a multivitamin tablet is safe when taking iron supplements. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The home health nurse is obtaining a history for a patient who has deep vein thrombosis and is taking warfarin 2 mg per day. Which statement by the patient is the best indicator that additional teaching about warfarin may be needed? 1. I have started to eat more healthy foods like green salads and fruit. 2. The doctor said that it is important to avoid becoming constipated. 3. Warfarin makes me feel a little nauseated unless I take it with food. 4. I will need to have some blood testing done once or twice a week. The correct answer is 1. I have started to eat more healthy foods like green salads and fruit. Patients taking warfarin are advised to avoid making sudden dietary changes because changing the oral intake of foods high in vitamin K will have an impact on the effectiveness of the medication. The other statements suggest that further teaching may be indicated, but more assessment for teaching needs is required first. A 67-year-old patient who is receiving chemotherapy for lung cancer is admitted to the hospital with thrombocytopenia. Which statement made by the patient when the nurse is obtaining the admission history is of most concern? 1. I've noticed that I bruise more easily since the chemotherapy started. 2. My bowel movements are soft and dark brown. 3. I take ibuprofen every day because of my history of osteoarthritis. 4. My appetite has decreased since the chemotherapy started. The correct answer is 3. I take ibuprofen every day because of my history of osteoarthritis. Because nonsteroidal anti-inflammatory drugs will decrease platelet aggregation, patients with thrombocytopenia should not use ibuprofen routinely. Patient teaching about this should be included in the care plan. Bruising is consistent with the patient's admission problem of thrombocytopenia. Soft, dark brown stools indicate that there is no frank or occult blood in the bowel movements. Although the patient's decreased appetite requires further assessment by the nurse, this is a common complication of chemotherapy. The charge nurse is making the daily assignments on the medical surgical unit. Which patient is best assigned to a float nurse who has come from the post-anesthesia care unit? 1. A 30-year-old patient with thalassemia major who has an order for subcutaneous infusion of deferoxamine. 2. A 43-year-old patient with multiple myeloma who requires discharge teaching. 3. A 52-year-old patient with chronic gastrointestinal bleeding who has returned to the unit after a colonoscopy. 4. A 65-year-old patient with pernicious anemia who has just been admitted to the unit. The correct answer is 3. A 52-year-old patient with chronic gastrointestinal bleeding who has returned to the unit after a colonoscopy. A nurse who works in the post-anesthesia care unit will be familiar with the monitoring needed for a patient who has just returned from a procedure such as a colonoscopy, which requires moderate sedation or monitored anesthesia care. Care of the other patients requires staff with more experience with various types of hematologic disorders and would be better to assign to nursing personnel who regularly work on the medical surgical unit. A 32-year-old patient with sickle cell anemia is admitted to the hospital during a sickle cell crisis. Blood pressure is 104/62, oxygen saturation is 85%, and the patient reports pain at a level 8. Which action prescribed by the healthcare provider will the nurse implement first? 1. Administer morphine sulfate 4 to 8 milligrams IV. 2. Give oxygen at 4 liters per minute via nasal cannula. 3. Start an infusion of normal saline at 200 ml per hour. 4. Apply warm packs to painful joints. The correct answer is 2. Give oxygen at 4 liters per minute via nasal cannula. National guidelines for sickle cell crisis indicate that oxygen should be administered if the oxygen saturation is less than 95%. Hypoxia and deoxygenation of the blood cells are the most common cause of sickling, so administration of oxygen is the priority intervention here. Pain control and hydration are also important interventions for this patient and should be accomplished rapidly. The nurse is reviewing the complete blood count for a patient who has been admitted for knee arthroscopy. Which value is most important to report to the healthcare provider before surgery? 1. Hematocrit of 33%. 2. Hemoglobin level of 10.9 grams per deciliter. 3. Platelet count of 426,000 cubic milliliters. 4. White blood cell count of 16,000 cubic milliliters. The correct answer is 4. White blood cell count of 16,000 cubic milliliters. Centers for Disease Control and Prevention guidelines for the prevention of surgical site infections indicate that surgery should be postponed when there is evidence of a pre-existing infection, such as an elevation in white blood cell count. The other values are slightly abnormal, but would not be likely to cause post-operative problems for knee arthroscopy. Which of these patients who have just arrived at the emergency department should the nurse assess first? 1. Patient who reports several dark, tarry stools and a history of peptic ulcer disease. 2. Patient with hemophilia A who is experiencing thigh swelling after a fall. 3. Patient who has pernicious anemia and reports paresthesia of the hands and feet. 4. Patient with thalassemia major who needs a scheduled blood transfusion. The correct answer is 2. Patient with hemophilia A who is experiencing thigh swelling after a fall. Thigh swelling after an injury in a patient with hemophilia likely indicates acute bleeding, which can compromise blood flow and nerve function in the leg, and should be treated immediately with the administration of factor replacement. The other patients also need assessment, treatment, or both, but the data do not indicate any immediate threat to life or function. A patient with sickle cell disease is admitted with splenic sequestration. The blood pressure is 86/40, and heart rate is 124 beats per minute. Which of these actions will the nurse take first? 1. Complete a head-to-toe assessment. 2. Draw blood for type and cross-match. 3. Infuse normal saline at 250 ml per hour. 4. Ask the patient about vaccination history. The correct answer is 3. Infuse normal saline at 250 ml per hour. Because the patient is severely hypotensive, correction of hypovolemia caused by the splenic sequestration is the most urgent action. Nevertheless, the other actions are appropriate because a complete assessment will be needed to plan care, a transfusion is likely to be needed, and vaccination history is pertinent for patients with sickle cell disease. Infusion of saline, however, is the priority need. The nurse is preparing to have a patient who has acute leukemia sign the permit for a bone marrow aspiration. The patient states that the oncologist has explained the procedure and the complications, and she has no further questions. What assessment is most important for the nurse to complete before the procedure is carried out? 1. Review the patient's do not resuscitate status. 2. Review the platelet count. 3. Review the leukocyte count. 4. Ask when the patient ate last. The correct answer is 2. Review the platelet count. The most important assessment to carry out before the procedure is to review the platelet count to ensure that the platelets are within normal limits. A complication of a bone marrow aspiration is bleeding, and platelets are necessary for normal clotting to take place. The nurse should also review the prothrombin time, partial thromboplastin time, and international normalized ratio for the same reason. A patient's DNR status should be reviewed in case of an emergency on all ill patients as a general rule. The leukocyte count in leukemia is expected to be altered and is not important when considering the bleeding complication. Usually, it is not necessary for a patient to be NPO before the procedure.
A nurse complains to the charge nurse that she is always assigned to the same patient with chronic depression. What should the charge nurse do? 1. Look at the assignment sheet and see if there is any way to switch assignments with another nurse. 2. Tell her to care for the patient today, but that her request will be considered for future assignments. 3. Remind her that continuity of care and patient-centered care are the primary goals. 4. Explain that patients with chronic conditions are more likely to fall under the nurse's scope of practice. The correct answer is 2. Tell her to care for the patient today, but that her request will be considered for future assignments. Rationale: switching the assignments at shift change or mid-shift creates delays for everyone, so politely ask her to continue for the day. Nevertheless, her request is not unreasonable. Dealing with depressed patients can be very exhausting, so consider her request for future assignments. Although many patients benefit from having the same caregiver, a chronically depressed patient might benefit from stimulation by various caregivers. Explaining scope of practice and continuity of care is probably not necessary and may seem condescending. The team must apply restraints to a combative patient to prevent harm to others or to self. Which action requires the charge nurse's intervention? 1. The psychiatric nursing assistant uses a quick-release knot to tie restraints. 2. The nurse secures the restraint to the side rail. 3. The nurse checks the pulses distal to the restraints. 4. The nurse explains to the patient why he is being restrained. The correct answer is 2. The nurse secures the restraint to the side rail. Rationale: the restraints must be tied to a stationary portion of the bed. Quick-release knots are for safety, in case the restraints need to be quickly removed. Distal pulses should be checked. The HCP or nurse is usually responsible for explaining the restraint procedure. However, restraining a combative patient is rarely a planned event, and the caregiver, who has the best relationship with the patient, may be the best spokesperson. A newly graduated nurse has just started working at the acute psychiatric unit. Which patient would be the best to assign to this nurse? 1. Patient who is frequently admitted for borderline personality disorder and suicidal gestures. 2. Patient admitted yesterday for disorganized schizophrenia and psychosis. 3. Patient newly admitted with possible differential diagnosis of depression, dementia, or delirium. 4. Patient newly diagnosed with major depression and rumination about loss and suicide. The correct answer is 4. Patient newly diagnosed with major depression and rumination about loss and suicide. Rationale: although the patient is ruminating about suicide, in the early phase of major depression, the patient has minimal energy to act. The danger of suicide will increase as the medication and therapy begin to help. A new nurse lacks experience with therapeutic boundary setting that is necessary for patients with borderline personality disorder. Psychotic patients can seem very threatening to new nurses, and it takes experience to interpret psychotic behavior. Depression, dementia, and delirium have some behavior and symptom overlap. This patient should be assigned to an experienced nurse until the delirium is treated or ruled out. The nurse is working with a healthcare provider who recently started treating patients with depression. Which action by the HCP would prompt the nurse to intervene? 1. Tells the patient and family that it may take 4 to 8 weeks before the antidepressant medication begins to relieve symptoms. 2. Prescribes 3 months of antidepressants for a patient newly diagnosed with depression and gives a 3-month follow-up appointment. 3. Instructs the patient that the initial dose is low but will gradually be increased to reach a maintenance dosage. 4. Tells the patient and the family to watch for and immediately report anxiety, agitation, irritability, or suicidal thoughts. The correct answer is 2. Prescribes 3 months of antidepressants for a patient newly diagnosed with depression and gives a 3-month follow-up appointment. Rationale: patients with depression are at high risk for suicide, and antidepressants can be used to commit suicide. For the patient who was recently diagnosed with depression and prescribed antidepressants, the nurse intervenes because a small number of doses should be prescribed and dispensed, and follow-up should be weekly to allow for close monitoring and assessment. The other options are correct information to share with patients and family members. The nurse is interviewing a patient with suicidal ideations and a history of major depression. Which comment is cause for greatest concern? 1. I have had problems with depression most of my adult life. 2. My father and my brother both committed suicide. 3. My wife is having health problems, and she relies on me. 4. I am afraid to kill myself, and I wish I had more courage. The correct answer is 2. My father and my brother both committed suicide. Rationale: the patient has a strong family history of completed suicide, which is an increased risk factor. The patient may believe that other family members have successfully used suicide to solve their problems. A long history of depression suggests that the problem is chronic. Assess for treatment history, risk factors, and coping strategies. Having a feeling of responsibility toward others and feeling fear are protective factors that can be used in the treatment plan. Which patient needs assessment first? 1. A patient who is having command hallucinations. 2. A patient who is demonstrating clang associations. 3. A patient who is verbalizing ideas of reference. 4. A patient who is using neologisms. The correct answer is 1. A patient who is having command hallucinations. Rationale: during command hallucinations, the patient may be getting a command to harm self or others. Content must be assessed. Ideas of reference occur when an ordinary thing or event has personal significance. Ideas of reference could escalate into aggression. If delusions of persecution are present, content must be assessed. Clang association is a meaningless rhyming of words, and neologisms are new words created by patients. These communication patterns create frustration for staff and patients, but there is no need for immediate intervention. After reviewing medication prescriptions on an acute psychiatric unit, which prescription is the nurse most likely to question? 1. Fluoxetine for a middle-aged patient with depression. 2. Chlorpromazine for a young patient with schizophrenia. 3. Loxapine for an older adult patient with dementia and psychosis. 4. Lorazepam for a young patient with generalized anxiety disorder. The correct answer is 3. Loxapine for an older adult patient with dementia and psychosis. Rationale: conventional antipsychotics are usually not prescribed for older adult patients with psychosis secondary to dementia because of the increased incidence of death, usually from cardiac problems or infection. Fluoxetine for depression, chlorpromazine for schizophrenia, and lorazepam for generalized anxiety disorder are viable options.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The charge nurse is reviewing the assignment sheet for an acute psychiatric unit. Which experienced team member should be reassigned? 1. Male nurse assigned to an older male patient with chronic depression and excessive rumination. 2. Young male psychiatric nursing assistant assigned to a female adolescent with anorexia nervosa. 3. Female nurse assigned to a newly admitted female patient who has command hallucinations and delusions of persecution. 4. Older female nurse with medical surgical experience assigned to a male patient with Alzheimer's disease. The correct answer is 2. Young male psychiatric nursing assistant assigned to a female adolescent with anorexia nervosa. Rationale: adolescents in general are self-conscious in the presence of members of the opposite sex, and teenagers with anorexia are overly concerned with their appearance. Therefore, it would be better to assign this patient to a mature female staff member. An experienced nurse is able to set boundaries and to assist patients with chronic health problems. An experienced nurse should be assigned to new admissions and to patients with acute safety issues. A nurse with medical surgical experience would be well acquainted with care issues related to dementia. A patient with a mental health disorder is brought to the emergency department by the police. In determining hospitalization versus discharge back into the community, which consideration is given the highest priority? 1. Willingness of person to follow the treatment plan. 2. Potential for harm to self or others. 3. Availability of family or social support. 4. Ability of person to meet own basic physical needs. The correct answer is 2. Potential for harm to self or others. Rationale: potential for harm to self or others would be the priority. However, the other options are also important in planning for long-term outcomes. Which patient is the most likely candidate for outpatient depot antipsychotic therapy? 1. Older man with psychosis secondary to dementia, who lives with his daughter. 2. Homeless veteran with schizophrenia, who occasionally sleeps in a nearby shelter. 3. Housewife with bipolar disorder, who has psychotic features during the manic phase. 4. Student with recently diagnosed schizophrenia, who lives at home with his parents. The correct answer is 2. Homeless veteran with schizophrenia, who occasionally sleeps in a nearby shelter. Rationale: depot antipsychotic therapy uses long-acting injectable medications. These medications are used for long-term maintenance for schizophrenia, for patients who may have some difficulties with adherence to taking medications. The homeless veteran has the least amount of social support and stability, which are factors in medication adherence. For the older adult patient with dementia and psychosis, identifying underlying factors and then behavioral therapies would be recommended first. Psychotic features in the manic phase of bipolar disorder would be treated as an acute episode. The student has the support of family, and the healthcare team will try to work with the patient and the family to build behaviors that support lifetime adherence to therapy.
The nurse has just received a change of shift report about these pediatric patients. Which patient will the nurse assess first? 1. A 1-year-old patient with hemophilia B who was admitted because of decreased responsiveness. 2. A 3-year-old patient with von Willebrand disease who has a dose of desmopressin scheduled. 3. A 7-year-old patient with acute lymphocytic leukemia who has chemotherapy-induced thrombocytopenia. 4. A 16-year-old patient with sickle cell disease who reports acute right lower quadrant abdominal pain. The correct answer is 1. A 1-year-old patient with hemophilia B who was admitted because of decreased responsiveness. Because decreased responsiveness in a 1-year-old patient with a clotting disorder may indicate intracerebral bleeding, this patient should be assessed immediately. The other patients also require assessments or interventions, but are not at immediate risk for life-threatening or disabling complications. The nurse is obtaining the history and physical information for a child who is recovering from Kawasaki disease and receives aspirin therapy. Which information concerns the nurse the most? 1. The child attends a daycare center 5 days a week. 2. The child's fingers have areas of peeling skin. 3. The child is very irritable and cries frequently. 4. The child has not received any immunizations. The correct answer is 4. The child has not received any immunizations. Children who receive aspirin therapy are at risk for the development of Reyes syndrome if they contract viral illnesses such as varicella or influenza, so the lack of immunization is the greatest concern for this child. Peeling skin on the fingers and toes and irritability are consistent with Kawasaki disease, but do not require any change in therapy. Because Kawasaki disease is not a communicable disease, there is no risk for transmission to other children in the daycare. The nurse is observing a preschool classroom of children between the ages of 3 to 4 years of age. When planning actions to ensure that each child meets normal developmental goals, which child will require the most immediate intervention? 1. A 3-year-old boy who needs help dressing. 2. A 4-year-old girl who has an imaginary friend. 3. A 4-year-old girl who engages only in parallel play. 4. A 3-year-old boy who draws stick figures. The correct answer is 3. A 4-year-old girl who engages only in parallel play. At 4 years of age, children engage in pretend play. Parallel play is seen in younger children between the ages of 2 and 3 years when they play side by side with limited interaction. The other behaviors are developmentally appropriate. The nurse will plan interventions to ensure that all the children meet developmental goals, but the 4-year-old child engaging only in parallel play will require the most immediate intervention. The nurse is assisting with the delivery of a 31-week gestational age premature newborn who requires intubation for respiratory distress syndrome. Which medication does the nurse anticipate will be needed first for this infant? 1. Theophylline. 2. Surfactant. 3. Dexamethasone. 4. Albuterol. The correct answer is 2. Surfactant. Research indicates that the administration of synthetic surfactant improves respiratory status and decreases the incidence of pneumothorax in premature infants with RDS. The other medications may be used if respiratory distress persists, but the first medication administered will be the surfactant. The nurse is providing nursing care for a newborn infant with respiratory distress syndrome who is receiving nasal continuous positive airway pressure ventilation. Which assessment finding is most important to report to the healthcare provider? 1. Apical pulse rate of 156 beats per minute. 2. Crackles audible in both lungs. 3. Tracheal deviation to the right. 4. Oxygen saturation of 93%. The correct answer is 3. Tracheal deviation to the right. Tracheal deviation suggests tension pneumothorax, a possible complication of positive pressure ventilation. The nurse will need to communicate rapidly with the HCP and assist with actions such as chest tube insertion. The heart rate, crackles, and oxygen saturation will be reported to the HCP but are expected in RDS and do not require immediate intervention. The nurse has obtained this assessment information about a 3-year-old patient who has just returned to the pediatric unit after having a tonsillectomy. Which finding requires the most immediate follow-up? 1. Frequent swallowing. 2. Hypotonic bowel sounds. 3. Reports of a sore throat. 4. Heart rate of 112 beats per minute. The correct answer is 1. Frequent swallowing. Frequent swallowing after a tonsillectomy may indicate bleeding. The nurse should inspect the back of the throat for evidence of bleeding. The other assessment results are expected in a 3-year-old child after surgery. The school nurse is performing developmental screenings for children who will be entering preschool. A 4-year-old girl excitedly tells the nurse about her recent birthday party. As she relates the details of the event, she frequently stutters. Which action by the nurse is most appropriate at this time? 1. Refer the child to an audiologist. 2. Obtain a detailed birth history from the parents. 3. Document the findings on the child's school record. 4. Refer the child to a speech pathologist. The correct answer is 3. Document the findings on the child's school record. Stuttering during the preschool years is a normal variation, particularly when excited or upset. The cause is attributed to preschool children increased cognitive abilities and imagination such that their speech cannot keep up with their thoughts. Documenting this on the child's record is important for continued observation to determine if it extends beyond the preschool years. While working in the pediatric clinic, the nurse receives a telephone call from the parent of a 13-year-old child who is receiving chemotherapy for leukemia. The patient's sibling has chickenpox. Which action will the nurse anticipate taking next? 1. Administer varicella-zoster immune globulin to the patient. 2. Teach the parent about the correct use of acyclovir. 3. Educate the parent about contact and airborne precautions. 4. Prepare to admit the patient to a private room in the hospital. The correct answer is 1. Administer varicella-zoster immune globulin to the patient. The administration of varicella-zoster immune globulin can prevent the development of varicella in immunosuppressed patients and will typically be prescribed. Acyclovir therapy and hospitalization may be required if the child develops a varicella-zoster virus infection. Contact and airborne precautions will be implemented to prevent the spread of infection to other children if the child is hospitalized with varicella. The nurse is preparing to care for a 6-year-old child who has just undergone allogenic stem cell transplantation. Which nursing tasks should the nurse delegate to the assistive personnel? Select all that apply. 1. Stocking the child's room with standard personal protective equipment items. 2. Teaching the child to perform thorough hand washing after using the bathroom. 3. Reminding the child to wear a face mask outside of the hospital room. 4. Assessing the child's oral cavity for signs and symptoms of infection. 5. Talking to the family members about the ways to reduce risk of infection. 6. Talk to the parents about local community and healthcare resources that will support the family after discharge. The correct answers are 1. Stocking the child's room with standard personal protective equipment items, and 3. Reminding the child to wear a face mask outside of the hospital room. Because all patient care staff members should be familiar with standard personal protective equipment, an AP will be able to stock the room. Reminding the child to wear a face mask is also a task that can be done by an AP, although the nurse is responsible for the initial teaching. Initially, teaching the child a good hand-washing technique, nursing assessments, and family education is within the scope of the nurse and not an AP. Talking to the family about local resources post-discharge should be done by either the nurse or the social services department. A 4-month-old infant boy is brought to the emergency department by his parents. He has been vomiting and fussy for the past 24 hours. On examination, there are circular bruises on his back. What priority assessment does the nurse anticipate? 1. Chest X-ray examination. 2. Ultrasonography of the head. 3. Electroencephalography. 4. Ophthalmologic examination. The correct answer is 4. Ophthalmologic examination. The history and physical examination suggest shaken baby syndrome. An ophthalmologic examination is indicated to determine if the infant has retinal hemorrhages characteristic of shaken baby syndrome. Electroencephalography may be indicated if there is evidence of seizures. Magnetic resonance imaging or computed tomography of the head can detect subdural hematomas. There is no evidence that would support the need for a chest X-ray examination. The pediatric unit charge nurse is making patient assignments for the evening shift. Which patient is most appropriate to assign to an experienced LPN/LVN? 1. A 1-year-old patient with severe combined immunodeficiency disease who is scheduled to receive chemotherapy in preparation for a stem cell transplant. 2. A 2-year-old patient with Wiskott-Aldrich syndrome who has orders for a platelet transfusion. 3. A 3-year-old patient who has chronic graft-versus-host disease and is incontinent of loose stools. 4. A 6-year-old patient who received chemotherapy 1 week ago and is admitted with increasing lethargy and a temperature of 101 degrees Fahrenheit. The correct answer is 3. A 3-year-old patient who has chronic graft-versus-host disease and is incontinent of loose stools. LPN/LVN scope of practice includes the care of patients with chronic and stable health problems, such as the patient with chronic graft-versus-host disease. Chemotherapy medications are considered high-alert medications and should be given by RNs who have received additional education in chemotherapy administration. Platelets and other blood products should be given by RNs. The 6-year-old patient has a history and clinical manifestations consistent with neutropenia and sepsis and should be assessed by an RN as quickly as possible. An 18-month-old child has oral mucositis secondary to chemotherapy. Which task should the nurse delegate to the assistive personnel? 1. Reporting evidence of severe mucosal ulceration. 2. Assisting the child in swishing and spitting mouthwash. 3. Assessing the child's ability and willingness to drink through a straw. 4. Feeding the child a bland, moist, soft diet. The correct answer is 4. Feeding the child a bland, moist, soft diet. Helping the child to eat is within the scope of responsibilities for an AP. Assessing ability and willingness to drink and checking for extent of mucosal ulceration are the responsibilities of a nurse. An 18-month-old child is not able to swish and spit, which could result in swallowing the mouthwash. Mouthwash is not intended for swallowing because it can contain alcohol and other ingredients not safe for ingestion. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A 6-year-old child who received chemotherapy and had anorexia is now cheerfully eating peanut butter, yogurt, and applesauce. When the mother arrives, the child refuses to eat and throws the dish on the floor. What is the nurse's best response to this behavior? 1. Remind the child that foods tasted good today and will help her or his body to get strong. 2. Allow the mother and child time alone to review and control the behavior. 3. Ask the mother to leave until the child can finish eating and then invite her back. 4. Explain to the mother that the behavior could be a normal expression of anger. The correct answer is 4. Explain to the mother that the behavior could be a normal expression of anger. Help the mother to understand that the child may be angry about being left in the hospital or about her inability to prevent the illness and protect the child. Reminding the child about the food and the purpose of the food does not address the strong emotions underlying the outburst. Allowing the mother and child time alone is a possibility, but the assumption would be that the mother understands the child's behavior and is prepared to deal with the behavior in a constructive manner. Asking the mother to leave the child suggests that the mother is a source of stress. A 3-month-old infant arrives at the health center for a scheduled well child visit. The parents ask the nurse why the infant extends the arms and legs in response to a loud sound. Which response by the nurse is best? 1. Inform the parents that this is a normal reflex that generally disappears by 4 to 6 months of age. 2. Tell the parents if the behavior does not change by 6 months, the infant will need further evaluation. 3. Remind the parents this is a normal response that indicates the infant's hearing is intact. 4. Reassure the parents that the behavior is normal and not an indicator of any problem such as cerebral palsy. The correct answer is 1. Inform the parents that this is a normal reflex that generally disappears by 4 to 6 months of age. The infant's behavior is consistent with the Moro and startle reflexes. The Moro reflex usually disappears by 6 months of age. The startle reflex usually disappears by 4 months of age. A hearing test is not based on response to loud sounds alone. Although it is true that further evaluation may be needed if the reflexes do not disappear, there is no need for the nurse to discuss this with the parents at this time. The infant's behavior is not consistent with cerebral palsy. A 25-year-old Gravida 2, Para 1 patient has come to the obstetric triage room at 32 weeks gestation, reporting painless vaginal bleeding. The nurse is providing orientation for a new nurse on the unit. Which statement by the new nurse to the patient would require the nurse to promptly intervene? 1. I'm going to check your vital signs. 2. I'm going to apply a fetal monitor to check the baby's heart rate and to see if you are having contractions. 3. I'm going to perform a vaginal examination to see if your cervix is dilated. 4. I'm going to feel your abdomen to check the position of the baby. The correct answer is 3. I'm going to perform a vaginal examination to see if your cervix is dilated. Painless vaginal bleeding can be a symptom of placenta previa. A digital vaginal examination is contraindicated until ultrasonography can be performed to rule out placenta previa. If a digital examination is performed when placenta previa is present, it can cause increased bleeding. The other statements reflect appropriate assessment of an incoming patient with vaginal bleeding. A 36-year-old Gravida 1, Para 0, patient has received an epidural anesthetic. Her cervix is 6 centimeters dilated. Her blood pressure is currently 60/38. Which nursing actions would be the priority? Select all that apply. 1. Place the patient in high Fowler position. 2. Turn the patient to a lateral position. 3. Notify the anesthesiologist. 4. Prepare for emergency cesarean section. 5. Decrease the IV fluid rate. 6. Observe closely for fetal heart rate decelerations. The correct answers are 2. Turn the patient to a lateral position. 3. Notify the anesthesiologist. And 6. Observe closely for fetal heart rate decelerations. The patient may be experiencing supine hypotension caused by the pressure of the uterus on the vena cava and the effects of the epidural medication. Maternal hypotension can cause uteroplacental insufficiency, leading to fetal hypoxia. Placing the woman in a lateral position can relieve the pressure on the vena cava. The anesthesiologist should be notified and may need to treat the patient with ephedrine to correct the hypotension. Fetal heart rate decelerations are common if maternal hypotension is not promptly corrected. IV fluids are increased per protocol when supine hypotension occurs. A 27-year-old patient underwent a primary cesarean section because of breech presentation 24 hours ago. Which assessment finding would be of the most concern? 1. Small amount of lochia rubra. 2. Temperature of 99 degrees Fahrenheit. 3. Slight redness and pain of the left calf. 4. Pain rated as 3 of 10 in the incisional area. The correct answer is 3. Slight redness and pain of the left calf. Slight redness and pain in the left calf could be suggestive of thrombophlebitis and requires further investigation. The other findings are within normal limits for this point in the postpartum and post-operative course. Which action by a newly graduated nurse during a delivery complicated by shoulder dystocia would require immediate correction by the nurse who is orienting her? 1. Applying fundal pressure. 2. Applying suprapubic pressure. 3. Requesting the immediate presence of the neonatologist. 4. Flexing the maternal legs back across the maternal abdomen. The correct answer is 1. Applying fundal pressure. Fundal pressure should never be applied in a case of shoulder dystocia because it may worsen the problem by impacting the fetal shoulder even more firmly into the symphysis pubis. This issue of patient safety would require the supervising nurse to intervene immediately. The other responses are appropriate actions in a case of shoulder dystocia. A pregnant woman at 12 weeks gestation tells the nurse that she is a vegetarian. Which action would the nurse take first? 1. Recommend vitamin B12 and iron supplementation. 2. Recommend consumption of protein drinks daily. 3. Obtain a 24-hour diet recall history. 4. Determine the reason for her vegetarian diet. The correct answer is 3. Obtain a 24-hour diet recall history. The care of a vegetarian woman who is pregnant should begin with an assessment of her diet because vegetarian practices vary widely. The nurse must first assess exactly what the woman's diet consists of and then determine any deficiencies. It is probable that the woman will need a vitamin B12 supplement, but the assessment comes first. Vegetarian diets can be completely adequate in protein, and therefore protein supplementation is not routinely recommended. The reason for the diet is less important than what the diet actually contains. A 24-year-old Gravida 1, para-0 patient is receiving oxytocin during her labor at 41 weeks gestation. Which nursing actions are appropriate when late fetal heart rate decelerations are identified? Select all that apply. 1. Discontinue the oxytocin. 2. Decrease the maintenance IV fluid rate. 3. Administer oxygen to the mother by mask. 4. Place the woman in high Fowler position. 5. Notify the healthcare provider. 6. Discontinue epidural anesthesia. The correct answers are 1. Discontinue the oxytocin. 3. Administer oxygen to the mother by mask. And 5. Notify the healthcare provider. Late fetal heart rate decelerations can be an ominous sign of fetal hypoxemia, especially if repetitive and accompanied by decreased variability. Notification of the HCP is indicated. Turning off the oxytocin and administering oxygen to the mother are recommended nursing interventions to improve fetal oxygenation. An increase, not a decrease, in the IV rate can improve hydration, correct hypovolemia, and increase blood flow to the uterus. Putting the woman in a lateral position can increase blood flow to the uterus and increase oxygenation to the fetus. The high Fowler position would not be helpful. Discontinuation of epidural anesthesia would not be indicated in the presence of late fetal heart rate decelerations. The anesthesia may be vitally important if the condition continues or worsens and necessitates a cesarean section. Promptly addressing fetal heart rate changes may allow intrauterine resuscitation and may decrease the need for cesarean section if those measures are effective. This supports the perinatal core measure of reducing cesarean section rates. The nurse is caring for a patient in labor at 39 weeks gestation and has identified mild variable fetal heart rate decelerations. Which action would the nurse take first? 1. Change the maternal position. 2. Notify the healthcare provider. 3. Prepare for delivery. 4. Readjust the fetal monitor. The correct answer is 1. Change the maternal position. The cause of variable fetal heart decelerations is compression of the umbilical cord, which can often be corrected by a change in maternal position. It is usually a benign condition and would not require the nurse to prepare for delivery or to notify the healthcare provider unless the variable decelerations are severe and persistent. Adjusting the fetal monitor may be needed after the change in maternal position, but would not directly address the variable decelerations. The telephone triage nurse in the prenatal clinic receives the following calls. Which telephone call would require immediate notification of the healthcare provider? 1. Patient reports leaking vaginal fluid at 34 weeks gestation. 2. Patient reports nausea and vomiting at 8 weeks gestation. 3. Patient reports pedal edema at 39 weeks gestation. 4. Patient reports vaginal itching at 20 weeks gestation. The correct answer is 1. Patient reports leaking vaginal fluid at 34 weeks gestation. Leaking vaginal fluid at 34 weeks gestation requires immediate attention because it could indicate premature rupture of membranes with the risk of premature birth. A nurse in a prenatal clinic can safely give telephone advice regarding nausea, vomiting, and pedal edema, which can be considered normal in pregnancy. The nurse would assess the complaint, give the patient evidence-based advice, and define the circumstances under which the patient should call back. Vaginal itching at 20 weeks gestation could indicate a yeast infection. Depending on clinic protocols, the nurse could, after phone assessment, Safely recommend an over-the-counter medication or arrange an office visit for the patient. A 24-year-old Gravida 2, Para 1 woman is being admitted in active labor at 39 weeks gestation. Which prenatal data would be most important for the nurse to address at this time? 1. Hemoglobin level of 11 grams per deciliter at 28 weeks gestation. 2. Positive result on test for Group B streptococci at 36 weeks gestation. 3. Urinary tract infection with Escherichia coli treated at 20 weeks gestation. 4. Elevated level on glucose screening test at 28 weeks gestation, followed by normal 3-hour glucose tolerance test results at 29 weeks gestation. The correct answer is 2. Positive result on test for Group B streptococci at 36 weeks gestation. The positive Group B streptococci result requires immediate action. The healthcare provider must be notified, and orders obtained for prompt antibiotic prophylaxis during labor to reduce the risk of mother-to-newborn transmission of Group B streptococci. The other data are not as significant in the care of the patient at this moment. Intrapartum appropriate antibiotic treatment of the mother with Group B streptococci supports the perinatal core measure of reducing healthcare-acquired bloodstream infections in newborns. A 19-year-old Gravida 1, Para 0 patient at 40 weeks gestation who is in labor is being treated with magnesium sulfate for seizure prophylaxis in preeclampsia. Which are priority assessments with this medication? Select all that apply. 1. Check deep tendon reflexes. 2. Observe for vaginal bleeding. 3. Check the respiratory rate. 4. Note the urine output. 5. Monitor for calf pain. 6. Watch for early fetal heart rate decelerations. The correct answers are 1. Check deep tendon reflexes. 3. Check the respiratory rate. And 4. Note the urine output. Magnesium sulfate toxicity can cause fatal cardiovascular events or respiratory depression or arrest, so monitoring of the respiratory rate is of utmost importance. The drug is excreted by the kidneys, and therefore monitoring for adequate urine output is essential. Deep tendon reflexes disappear when serum magnesium is reaching a toxic level. Vaginal bleeding is not associated with magnesium sulfate use. Calf pain can be a sign of a deep vein thrombosis, but is not associated with magnesium sulfate therapy. Early fetal heart rate decelerations are not associated with use of magnesium sulfate. A 30-year-old woman with type 1 diabetes mellitus comes to the clinic for preconception care. Which information would be the priority to communicate to her at this time? 1. Her insulin requirements will likely increase during the second and third trimesters of pregnancy. 2. Infants of mothers with diabetes can be macrosomic, which can result in a more difficult delivery and a higher likelihood of cesarean section. 3. Breastfeeding is highly recommended, and insulin use is not a contraindication. 4. Achievement of optimal glycemic control at this time is of utmost importance in preventing congenital anomalies. The correct answer is 4. Achievement of optimal glycemic control at this time is of utmost importance in preventing congenital anomalies. The incidence of congenital anomalies is 3 times higher in the offspring of women with diabetes. Good glycemic control during preconception and early pregnancy significantly reduces this risk and would be the highest priority message to this patient at this point. The other responses are correct, but are not of greatest importance at this time.
Health history. Hypertension for 10 years. Takes hydrochlorothiazide 25 mg daily. Blood pressure ranges from 110/60 to 132/72. Family history. Patient's mother and 2 siblings have had myocardial infarctions. Social history. 20-pack-year history of cigarette use. Walks 2 to 3 miles daily. While reviewing a hospitalized patient's medical record, the nurse obtains this information about cardiovascular risk factors. Which interventions will be important to include in the discharge plan for this patient? Select all that apply. 1. Referral to community programs that assist in smoking cessation. 2. teaching about the impact of family history on cardiovascular risk. 3. Education about the need for a change in antihypertensive therapy. 4. Assistance in reducing emotional stress. 5. Discussion of the risks associated with having a sedentary lifestyle. 6. Teaching about the signs of hypokalemia and foods to supplement potassium loss. The correct answers are 1. Referral to community programs that assist in smoking cessation, 2. Teaching about the impact of family history on cardiovascular risk, and 6. Teaching about the signs of hypokalemia and foods to supplement potassium loss. Rationale: the patient's major modifiable risk factor is ongoing smoking. The family history is significant, and the patient should be aware that this increases cardiovascular risk. The blood pressure is well controlled on the current medication, and no change is needed. There is no indication that stress is a risk factor for this patient, and the patient's activity level meets the American Heart Association recommendation for at least 150 minutes of moderate activity weekly. Hydrochlorothiazide can deplete potassium. Muscle weakness and cramping are signs of hypokalemia. Bananas, yogurt, spinach, and avocados are some foods that are high in potassium. An LPN/LVN, under the RN supervision, is assigned to provide nursing care for a patient with Guillain-Barré syndrome. What observation should the LPN/LVN be instructed to report immediately? 1. Reports of numbness and tingling. 2. Facial weakness and difficulty speaking. 3. Rapid heart rate of 102 beats per minute. 4. Shallow respirations and decreased breath sounds. The correct answer is 4. Shallow respirations and decreased breath sounds. Rationale: the priority intervention for a patient with GBS is maintaining adequate respiratory function. Patients with GBS are at risk for respiratory failure, which requires urgent intervention. The other findings are important and should be reported to the nurse, but they are not life-threatening.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The nurse notes that a patient with myasthenia gravis has an elevated temperature of 102.2 degrees Fahrenheit, an increased heart rate of 120 beats per minute, and a rise in blood pressure of 158/94, and is incontinent of urine and stool. What is the nurse's best action at this time? 1. Administer an acetaminophen suppository. 2. Notify the health care provider immediately. 3. Recheck vital signs in 1 hour. 4. Reschedule the patient's physical therapy. The correct answer is 2. Notify the health care provider immediately. Rationale: the changes that the nurse notes are characteristic of myasthenic crisis, which often follows some type of infection. The patient is at risk for inadequate respiratory function. In addition to notifying the HCP, or Rapid Response Team, the nurse should carefully monitor the patient's respiratory status. The patient may need intubation and mechanical ventilation. The critical care nurse is assessing a patient whose baseline Glasgow Coma Scale score in the emergency department was 5. The current GCS score is 3. What is the nurse's best interpretation of this finding? 1. The patient's condition is improving. 2. The patient's condition is deteriorating. 3. The patient will need intubation and mechanical ventilation. 4. The patient's medication regime will need adjustments. The correct answer is 2. The patient's condition is deteriorating. Rationale: the GCS is used in many acute care settings to establish baseline data in these areas: eye-opening, motor response, and verbal response. The patient is assigned a numeric score for each of these areas. The lower the score, the lower the patient's neurological function. A decrease of 2 or more points in the Glasgow Coma Scale score total is clinically significant and should be communicated to the health care provider immediately. A patient with a cervical spinal cord injury has been placed in fixed skeletal traction with a halo fixation device. When caring for this patient, the charge nurse may assign which actions to the LPN/LVN. Select all that apply. 1. Checking the patient's skin for pressure from the device. 2. Assessing the patient's neurologic status for changes. 3. Observing the halo insertion sites for signs of infection. 4. Cleaning the halo insertion sites with hydrogen peroxide. 5. Developing the nursing plan of care for the patient. 6. Administering oral medications as prescribed. The correct answers are 1. Checking the patient's skin for pressure from the device. 3. Observing the halo insertion sites for signs of infection. 4. Cleaning the halo insertion sites with hydrogen peroxide. And 6. Administering oral medications as prescribed. Rationale. Checking and observing for signs of pressure or infection is within the scope of practice of the LPN/LVN. The LPN/LVN also has the appropriate skills for cleaning the halo insertion sites with hydrogen peroxide. Administering oral drugs is within the scope of practice for an LPN/LVN. Neurologic examination and care plan development require additional education and skill appropriate to the professional RN. Which patient should the charge nurse assign to the traveling nurse, new to neurologic nursing care, who has been on the neurologic unit for 1 week? 1. A 34-year-old patient with newly diagnosed multiple sclerosis. 2. A 68-year-old patient with chronic amyotrophic lateral sclerosis. 3. A 56-year-old patient with Guillain-Barré syndrome in respiratory distress. 4. A 25-year-old patient admitted with AC4 level spinal cord injury. The correct answer is 2. A 68-year-old patient with chronic amyotrophic lateral sclerosis. Rationale. The traveling nurse is relatively new to neurologic nursing and should be assigned patients whose condition is stable and not complex, such as the patient with chronic ALS. The newly diagnosed patient with MS will need a lot of teaching and support. The patient with GBS in respiratory distress will need frequent assessments and may need to be transferred to the intensive care unit. The patient with AC4 level SCI is at risk for respiratory arrest. All 3 of these patients should be assigned to nurses experienced in neurologic nursing care. The nurse is helping a patient with a spinal cord injury to establish a bladder retraining program. Which strategies may stimulate the patient to void? Select all that apply. 1. The stroking of the inner thigh. 2. The pulling of pubic hair. 3. Initiating intermittent straight catheterization. 4. Tapping the bladder to stimulate the detrusor muscle. 5. Reminding the patient to void in a urinal every hour while awake. The correct answers are 1. The stroking of the inner thigh, 2. The pulling of pubic hair, and 4. Tapping the bladder to stimulate the detrusor muscle. Rationale. All of the strategies except straight catheterization may stimulate voiding in patients with an SCI. Intermittent bladder catheterization can be used to empty the patient's bladder, but it will not stimulate voiding. To use a urinal, the patient must have bladder control, which is often absent after an SCI. In addition, every hour while awake would be too often, and would ignore the bladder filling at night. A patient with a spinal cord injury at level C3 to C4 is being cared for by the nurse in the emergency department. What is the priority nursing assessment? 1. Determine the level at which the patient has intact sensation. 2. Assess the level at which the patient has retained mobility. 3. Check blood pressure and pulse for signs of spinal shock. 4. Monitor respiratory effort and oxygen saturation level. The correct answer is 4. Monitor respiratory effort and oxygen saturation level. Rationale. The first priority for the patient with a spinal cord injury is assessing respiratory patterns and ensuring an adequate airway. A patient with a high cervical injury is at risk for respiratory compromise because spinal nerves C3 through C5 innervate the phrenic nerve, which controls the diaphragm. The other assessments are also necessary, but are not as high a priority. The nurse is floated from the emergency department to the neurologic floor. Which action should the nurse delegate to the assistive personnel when providing nursing care for a patient with a spinal cord injury? 1. Assessing the patient's respiratory status every 4 hours. 2. Checking and recording the patient's vital signs every 4 hours. 3. Monitoring the patient's nutritional status, including calorie counts. 4. Instructing the patient how to turn, cough, and breathe deeply every 2 hours. The correct answer is 2. Checking and recording the patient's vital signs every 4 hours. Rationale. The AP's training and education covers measuring and recording vital signs. The AP may help with turning and repositioning the patient, and may remind the patient to cough and deep breathe, but he or she does not teach the patient how to perform these actions. Assessing and monitoring patients require additional education and are appropriate to the scope of practice of professional nurses. A patient with a spinal cord injury reports a sudden severe throbbing headache that started a short time ago. Assessment of the patient reveals increased blood pressure of 168/94 and decreased heart rate of 48 beats per minute, diaphoresis, and flushing of the face and neck. What action should the nurse take first? 1. Administer the ordered acetaminophen. 2. Check the indwelling catheter tubing for kinks or obstruction. 3. Adjust the temperature in the patient's room. 4. Notify the health care provider about the change in status. The correct answer is 2. Check the indwelling catheter tubing for kinks or obstruction. Rationale. The patient's signs and symptoms are characteristic of autonomic dysreflexia, a neurological emergency that must be promptly treated to prevent a hypertensive stroke. The cause of this syndrome is noxious stimuli, most often a distended bladder or constipation, so checking for poor catheter drainage, bladder distension, and fecal impaction is the first action that should be taken. Adjusting the room temperature may be helpful because too cool of a temperature in the room may contribute to the problem. Acetaminophen will not decrease the autonomic dysreflexia that is causing the patient's headache. Notifying the HCP may be necessary if nursing actions do not resolve symptoms. A patient with Parkinson's disease has a problem with decreased mobility related to neuromuscular impairment. The nurse observes the assistive personnel performing all of these actions. For which action must the nurse intervene? 1. Helping the patient ambulate to the bathroom and back to bed. 2. Reminding the patient not to look at his feet when he is walking. 3. Performing the patient's complete bathing and oral care. 4. Setting up the patient's tray and encouraging the patient to feed himself. The correct answer is 3. Performing the patient's complete bathing and oral care. Rationale. Although all of these actions fall within the scope of practice for an AP, the AP should help the patient with morning care as needed, but the goal is to keep the patient as independent and mobile as possible. The patient should be encouraged to perform as much morning care as possible. Assisting the patient in ambulating, reminding the patient not to look at his feet, and encouraging the patient to feed himself are all appropriate to the goal of maintaining independence. The nurse is preparing to discharge a patient with chronic low back pain. Which statement by the patient indicates the need for additional teaching? 1. I will avoid exercise because the pain gets worse. 2. I will use heat or ice to help control the pain. 3. I will not wear high-heeled shoes at home or work. 4. I will purchase a firm mattress to replace my old one. The correct answer is 1. I will avoid exercise because the pain gets worse. Rationale. Exercises are used to strengthen the back, relieve pressure on compressed nerves, and protect the back from re-injury. Ice, heat, and firm mattresses are appropriate interventions for back pain. People with chronic back pain should avoid wearing high-heeled shoes at all times. A nursing student is teaching a patient and family about epilepsy before the patient's discharge. For which statement should the nurse intervene? 1. You should avoid consumption of all forms of alcohol. 2. Wear your medical alert bracelet at all times. 3. Protect your loved one's airway during a seizure. 4. It's okay to take over-the-counter medications. The correct answer is 4. It's okay to take over-the-counter medications. Rationale. A patient with a seizure disorder should not take over-the-counter medications without consulting with the healthcare provider first. The other three statements are appropriate teaching points for patients with seizure disorders and their families. After a patient has a seizure, which action can the nurse delegate to the assistive personnel? 1. Documenting the seizure. 2. Performing neurological checks. 3. Checking the patient's vital signs. 4. Restraining the patient for protection. The correct answer is 3. Checking the patient's vital signs. Rationale. Measurement of vital signs is within the education and scope of practice of APs. The nurse should perform neurological checks and document the seizure. Patients with seizures should not be restrained, however, the nurse may guide the patient's movements, if necessary, to prevent injury. The charge nurse is preparing to admit a patient with a seizure disorder. Which action can be assigned to an LPN/LVN? 1. Completing the admission assessment. 2. Setting up oxygen and suction equipment. 3. Placing a padded tongue blade at the bedside. 4. Patting the side rails before the patient arrives. The correct answer is 2. Setting up oxygen and suction equipment. Rationale. The LPN/LVN scope of practice includes setting up the equipment for oxygen and suctioning. The RN should perform the complete initial assessment. Controversy exists as to whether padded side rails actually provide safety, and their use may embarrass the patient and family. Tongue blades should never be at the bedside and should never be inserted into the patient's mouth after a seizure begins. The nurse is creating a teaching plan for a patient with newly diagnosed migraine headaches. Which key items will be included in the teaching plan? Select all that apply. 1. Foods that contain tyramine, such as alcohol and aged cheese, should be avoided. 2. Drugs such as nitroglycerin and nifedipine should be avoided. 3. Abortive therapy is aimed at eliminating the pain during the aura. 4. A potential side effect of medications is rebound headache. 5. Complementary therapies such as biofeedback and relaxation may be helpful. 6. Estrogen therapy should be continued as prescribed by the patient's healthcare provider. The correct answers are 1. Foods that contain tyramine, such as alcohol and aged cheese, should be avoided. 2. Drugs such as nitroglycerin and nifedipine should be avoided. 3. Abortive therapy is aimed at eliminating the pain during the aura. 4. A potential side effect of medications is rebound headache. And 5. Complementary therapies such as biofeedback and relaxation may be helpful. Rationale. Medications such as estrogen supplements may actually trigger a migraine headache attack and should be avoided. All of the other statements are accurate and should be included in the teaching plan. The nurse on the neurologic acute care unit is assessing the orientation of a patient with severe headaches. Which questions would the nurse use to determine orientation? Select all that apply. 1. When did you first experience the headache symptoms? 2. Did the mayor of Cleveland run as a Democrat or Republican? 3. What is your healthcare provider's name? 4. What year and month is it? 5. What is the address of your parents' house? 6. What is the name of this healthcare facility? The correct answers are 1. When did you first experience the headache symptoms? 3. What is your healthcare provider's name? 4. What year and month is it? And 6. What is the name of this healthcare facility? Rationale. After determining alertness in a patient, the next step is to evaluate orientation. When the patient's attention is engaged, ask him or her questions to determine orientation. Varying the sequence of questioning on repeated assessments prevents the patient from memorizing the answers. Responses that indicate orientation include the ability to answer questions about person, place, and time, so the nurse should ask for information relating to the onset of the patient's symptoms, the name of his or her healthcare provider, the year and month, his or her address, and the name of the referring physician or healthcare agency. Asking about the mayor's affiliation, or for his or her parents' address, may be inappropriate to assess orientation.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
What is the priority nursing concern for a patient experiencing a migraine headache? 1. Pain. 2. Anxiety. 3. Hopelessness. 4. Risk of brain injury. The correct answer is 1. Pain. Rationale. The priority for interdisciplinary care for the patient experiencing a migraine headache is pain management. All of the other problems are accurate, but none of them is as urgent as the issue of pain, which is often incapacitating. The nurse in the ER assesses a 21-year-old new admission who was in a motor vehicle crash. On assessment, the nurse discovers the patient has the pictured manifestation. Which injury does this finding indicate to the nurse? 1. Frontal skull fracture. 2. Basilar skull fracture. 3. Orbital fracture. 4. Temporal fracture. The correct answer is 2. Basilar skull fracture. Rationale. The location of a fracture determines the signs and symptoms that develop over several hours. This figure shows battle sign, which is a common clinical sign for a basilar skull fracture. Another sign of this type of fracture is raccoon eyes. It is usually accompanied by a tear in the dura with leaking of cerebrospinal fluid, so rhinorrhea or otorrhea are also present. The other 3 types of fracture have different signs, depending on the location. The nurse is assessing a patient with a neurologic health problem and discovers a change in level of consciousness from alert to lethargic. What is the nurse's best action? 1. Perform a complete neurological assessment. 2. Assess the cranial nerve functions. 3. Contact the rapid response team. 4. Reassess the patient in 30 minutes. The correct answer is 3. Contact the rapid response team. Rationale. A change in level of consciousness and orientation is the earliest and most reliable indication that central neurologic function has declined. If a decline occurs, the nurse should contact the rapid response team or healthcare provider immediately. The nurse should also perform a focused assessment to determine if there are any other changes. Health history. Denies any chronic health problems. Takes no medications currently. Physical exam. Height, 5 feet, 6 inches. Weight, 115 pounds. Body mass index, 18.6. Social and diet history. Works as an accountant. 1 glass of wine once or twice weekly. Eats fast food frequently. Based on this information in a patient's medical record, which topic is the highest priority for the nurse to include in the initial teaching plan for a 26-year-old patient who has blood pressures ranging from 150/84 to 162/90? 1. Symptoms of acute stroke and myocardial infarction. 2. Adverse effects of alcohol on blood pressure. 3. Methods for decreasing dietary caloric intake. 4. Low-sodium food choices when eating out. The correct answer is 4. Low-sodium food choices when eating out. Rationale. Current guidelines recommend low-sodium intake for lifestyle management of hypertension, and the nurse should teach the patient about the high sodium content in many fast foods and how to make low-sodium choices. A 26-year-old with this level of hypertension is not likely to have a stroke or myocardial infarction. Weight loss or changes in alcohol intake are not necessary. The patient's weight and BMI are normal. Alcohol intake of less than 1 or 2 glasses of wine daily is recommended to prevent hypertension. The nurse makes a home visit to evaluate a hypertensive patient who has been taking enalapril. Which finding is most important to report to the healthcare provider? 1. Patient reports frequent urination. 2. Patient's blood pressure is 138/86. 3. Patient complains about a frequent dry cough. 4. Patient says, I get dizzy sometimes if I stand up fast. The correct answer is 3. Patient complains about a frequent dry cough. Rationale: a persistent and irritating cough is a possible adverse effect of angiotensin-converting enzyme inhibitors, such as enalapril, and is a common reason for changing to another medication category, such as the angiotensin II receptor blockers. The other assessment data indicate a need for more patient teaching and ongoing monitoring, but would not require a change in therapy. The healthcare provider prescribes these actions for a patient who was admitted with acute substernal chest pain. Which actions are appropriate to assign to an experienced LPN/LVN who is working in the emergency department? Select all that apply. 1. Attaching cardiac monitor leads. 2. Giving heparin 5,000 units IV push. 3. Administering morphine sulfate 4 mg IV. 4. Obtaining a 12-lead electrocardiogram. 5. Asking the patient about pertinent medical history. 6. Having the patient chew and swallow aspirin 162 mg. The correct answers are 1. Attaching cardiac monitor leads, 4. Obtaining a 12-lead electrocardiogram, and 6. Having the patient chew and swallow aspirin 162 mg. Rationale: attaching cardiac monitor leads, obtaining an ECG, and administering oral medications are within the scope of practice for LPN/LVNs. An experienced LPN/LVN would be familiar with these activities. Although anticoagulants and narcotics may be administered by LPNs/LVNs to stable patients, these are high-alert medications that should be given by the RN to this unstable patient. Obtaining a pertinent medical history requires RN-level education and scope of practice. A patient who has just arrived in the emergency department reports substernal and left arm discomfort that has been going on for about 3 hours. Which laboratory test will be most useful in determining whether the nurse should anticipate implementing the acute coronary syndrome standard protocol? 1. Creatine kinase MB level. 2. Troponin I level. 3. Myoglobin level. 4. C-reactive protein level. The correct answer is 2. Troponin I level. Rationale: cardiac troponin levels are elevated 3 hours after the onset of myocardial infarction and are very specific to cardiac muscle injury or infarction. Creatine kinase MB and myoglobin levels also increase with MI, but creatine kinase levels take at least 6 hours to increase, and myoglobin is nonspecific. Elevated C-reactive protein levels are a risk factor for coronary artery disease, but are not useful in detecting acute injury or infarction. When the nurse is monitoring a 53-year-old patient who is undergoing a treadmill stress test, which finding will require the most immediate action? 1. Blood pressure of 152/88. 2. Heart rate of 134 beats per minute. 3. Oxygen saturation of 91%. 4. 3 premature ventricular contractions in a row. The correct answer is 4. 3 premature ventricular contractions in a row. Rationale: 3 PVCs in a row indicate non-sustained ventricular tachycardia and are an indication to stop the testing to avoid a worsening dysrhythmia. Moderate elevations in blood pressure and heart rate and slight decreases in oxygen saturation are a normal response to exercise and are expected during stress testing. Which topics will the nurse plan to include in discharge teaching for a patient who has been admitted with heart failure? Select all that apply. 1. How to monitor and record daily weight. 2. Importance of stopping exercise if heart rate increases. 3. Symptoms of worsening heart failure. 4. Purpose of chronic antibiotic therapy. 5. How to read food labels for sodium content. 6. Date and time for follow-up appointments. The correct answers are 1. How to monitor and record daily weight. 3. Symptoms of worsening heart failure. 5. How to read food labels for sodium content. And 6. Date and time for follow-up appointments. Rationale. To avoid rehospitalization, topics that should be included when discharging a patient with heart failure include how to maintain a low-sodium diet, the purpose and common side effects of medications, such as angiotensin-converting enzyme inhibitors and beta blockers, what to do if symptoms of worsening heart failure occur, and the scheduling of follow-up appointments. The nurse will teach the patient that a moderate increase in heart rate and respiratory effort is normal with exercise. Antibiotics are not included in the treatment regimen for heart failure, which is not an infectious process. A nurse is admitting a patient to the cardiac unit who has stable angina and a history of type 2 diabetes mellitus. The patient is scheduled for a cardiac catheterization the next day. Which medication would need to be withheld for 24 hours before the procedure and for 48 hours after the procedure? 1. Glucophage. 2. Glympyride. 3. Pravastatin. 4. Vitamin C. The correct answer is 1. Glucophage. Rationale. Glucophage should be withheld 24 hours before and 48 hours after cardiac catheterization. Contrast medium is used during a cardiac catheterization and can affect kidney function, leaving the patient at an increased risk for lactic acidosis. The rest of the medications do not need to be withheld for longer than the recommended time that the patient would need to be NPO.
You can get the NCLEX Mastery Bundle now, link is in the description, or you can get it at alphanurseguide.com.